Okay, ladies and gentlemen, I think we are now live. I want to apologize for the late start. A number of committee members were locked in another meeting, so I apologize for a late start this morning. This is the Education, Health, and Environmental Affairs Committee for our morning bill hearing session. We have about 15 bills today. We'll get through some and we'll go until maybe 12:45 this morning, and then break and then return at possibly 1:30. Roughly, that'll be the plan of attack. We'll start with the sponsor of each bill. After the sponsor, we'll have proponents. The first lead proponent will have up to 5 minutes. Subsequently, they'll have up to 2.5 minutes. I will try to announce if there's no opposition to the bill, so you can tailor your comments accordingly. Then we'll have questions, and we'll have anybody with favorable with amendments. If you are favorable with amendments, please make sure you discuss the amendments. Don't just talk generically about the bill. Then we'll go to the opponents and take questions for those folks as well. With that being said, we are going to start with Senate Bill 785, introduced by the Senate President. And that bill is entitled State Board of Education Membership in Terms, Capability and Capacity Study of Education Agencies. The Senate President will speak first. Then we will move to Shamoya Gardner, Tina Dove, and Clarence Crawford. Then we'll take questions. On the testimony list, there is no one in opposition, although I must say there are people who have favorable with amendments which could show some opposition or disagreement. With that, welcome, Mr. Senate President, Senator Ferguson.
Thank you, Mr. Chairman and members of the committee. It is a pleasure to be here with you all today. Look, we have been through an ongoing conversation about the future of Maryland public education for the last 4 years. After an enormous amount of work laying out a plan for the next 12 years, we are engaging now, after we have overridden the governor's veto, on a new path forward. One of the challenges throughout this whole process is how do we make sure, or the question has been, how do we make sure that the promise that we are making, the assurances that we are giving, that we can implement with fidelity and accountability. We've added the Accountability and Implementation Board, but there is a symbiotic relationship between the AIB board and the ongoing State Board of Education. Over this last year, and of course, this is a once in 100-year extraordinary moment, I have to say on a personal level, I've been frustrated. And frustrated as a parent, as an elected official, because I think a lot of the challenge that we are seeing with the reopening of schools, with the concerns about safety, what we've needed over the last year from the State Board of Education is certainty and clarity and a sense of purpose about where we are trying to go. Over the summer, I had conversations with members of the board and the superintendent, and I think there were opportunities to engage to help provide the context, not just advice, not just support, but provide the true framework for reopening safely to help school districts make those hard decisions to protect educators, but also ensure that families had access to in-person learning. That wasn't there this year. And I think it has been enormously, enormously challenging. So what do we do about it? There's no real obvious answer. And I want to be very clear about that. There's no certainty about what the best way forward is when you think of something as complex as our public school system. But what I know is that as we are moving forward, as we are engaging in a brand new path on this blueprint, we have the opportunity to really be a bit more purposeful in the way that we structure our state board. And let's be very clear, it is a heavy task to ask somebody for no compensation to serve and oversee a $7 billion operation. That is no small request. And only in the public sector do we see sort of the governance of a $7 billion entity having a volunteer basis. And so I do appreciate members of the board and their commitment to public service. What is essential is that as the board changes, as we move forward, I think there are opportunities to really hone in. And so we've put forward qualifications around the types of expertise that we think should be incorporated as members of the board rotate on and as we start to implement the blueprints. What Senate Bill 785 does is puts out certain criteria of specific board members. I really leave it to the judgment and wisdom and expertise of this committee. Certainly I'm sure that in any list, you will always leave something off or potentially be over-inclusive of something. We try to strike a balance. One of the core tenets of Maryland's public education system and its governance at the state level is that it is insulated 1 degree from the politics of the day. We have an independent board of education that selects the superintendent because, we all know the whims of politics can move things very quickly. And so the state board is this entity that is supposed to stand up and do what is best for kids, for the system, for our communities. And so it is important to maintain that one step of independence while ensuring that we have the expertise needed to provide ongoing governance support. There's a second component of Senate Bill 785. And that looked at the restructuring of the agency overall. This is not a new conversation. This is something that we've been debating back and forth for many, many years about the role of MHEC and our pipelines and early childhood, our special education needs, our students with disabilities. All of the various pieces have over time, the agencies had to take on more and more. And I think this is a moment as we're rethinking the operation of individual schools, that we also take a moment to look at the overall operation of our Maryland State Board of Education generally, so that we can be set up and have a world-class agency overseeing world-class schools. So that is fundamentally the purpose behind this bill. I greatly appreciate members' thoughtfulness and conversation throughout this. And conversations with the chairman and members of the committee, and I would urge a favorable committee report.
Mr. Senate President, I don't know how your schedule is. There are 2 or 3 speakers, proponents. I can hold questions, or if you're under time crunch, more than happy to entertain questions right now. All
good, please. Feel free to, I'm good.
Okay, Ms. Gardner from Strong Schools, Maryland, you're up, followed by Ms. Dove.
Good morning, Chair Pinsky, Vice Chair Kagan, and members of the Senate Education, Health, and Environmental Affairs Committee. My name is Shamoya Gardner. For the record, I am Deputy Director at Strong Schools, Maryland, where we are working to create world-class public schools for every single student in the state. Strong Schools Maryland is in support of Senate Bill 785 for 2 primary reasons. First, the blueprint implementation capacity study that the bill would then require be undertaken. I want to, for a moment, highlight the fact that this work was supposed to have been done. We expected that government and its entities would work. And the fact that it didn't when it was supposed to is the exact kind of institutional betrayal that we cannot allow to continue in the state's education system. When our low-income families and then public school students and school community members expect that decisions will be made that take into account what is necessary and what is possible, what is going to be the best use of the funds we're investing, we expect that those things will happen. Beyond that, successful implementation of the blueprint is not only critical to recovery from this pandemic, but also critical as we shift and pivot to what it is that our students we're educating now are going to need in their futures, not just what it is that has worked in the past. And the second reason that Strong Schools is supportive of this legislation is because as times change, as we get deeper into the 21st century, we have to let go of the notion that everything we know is what we're going to need to move forward. Qualifications must change. We do need that world-class governing entity, but in particular, we need these anti-racist perspectives implementing systemic change if we expect our public schools to do anything more than what they have done in the past. We have an opportunity to make things right. And for all those reasons, we urge a favorable report.
Thank you, Ms. Gardner. Ms. Dove, MSEA.
Good morning, Mr. Chair, Madam Vice Chair, Mr. President, and members of the committee. My name is Tina Dove. I'm with the Maryland State Education Association. As we all know, our state and our nation are living through an unprecedented time, one in which all sense of normal is being reinterpreted and reestablished. I've been an educator for over 20 years, and never in my career have I seen more colleagues in the field called to confront circumstances either personally or professionally, that are as challenging and consequential as the ones they face now. When the General Assembly passed the blueprint for Maryland's future, we all knew that fundamental systemic change was ahead for education. We had no idea, however, the magnitude or the nature of the tectonic shift the COVID global pandemic would bring to our state, nor did we truly understand the lasting impacts it would have on us all, especially our children. What we educators do know, however, is that the triage, mitigation, and remediation that our students and education system will need will require an all-hands-on-deck approach as we begin to reopen schools for in-person instruction and well into the future. It is critical that the people and state agencies tasked with leading these efforts be the most qualified, most knowledgeable, and best equipped to meet the moment. MSEA believes that Senate Bill 785 ensures that just such a caliber of leaders are the ones appointed to serve on our State Board of Education. This, along with the policy and funding changes enacted in the blueprint, will place our state and our education system on the right path toward recovering from this pandemic and confidently bringing to fruition the unwavering goal of educators as well as the members of the Kirwan Commission and the General Assembly to provide each and every child in Maryland with world-class education. We ask for a favorable report on Senate Bill 785, and we thank the President for his introduction of such an important piece of legislation. Thank you, Mr. Chair.
Thank you, Ms. Dove. Next, we have State Board of Education Chair Crawford. Before I pass it on to President Crawford, I want to state that he has favorable with amendments. And I want to thank you, President Crawford, for at least giving very specific amendments that the committee can look at and work on and either agree or disagree. I'm not speaking to endorse the amendments, but the testimony is very specific and concrete. And unfortunately, that's missing in some of the testimony before this committee. So with that, President Crawford, welcome to EHE.
Thank you very much. Good morning, Mr. Chairman, Vice Chair, President Ferguson, and members of the committee. Stated, my name is Clarence Crawford. I'm the President of the State Board of Education. We're here in support of Bill 875 with proposed amendments. We support the timeframes for the appointment. We have no substantial issues with the qualifications of the members. We believe most of our members largely meet those qualifications. We just offer a couple of suggestions as you look at this to create the necessary flexibility to respond to anticipated as well as black swan type changes that could occur. So in section 6, suggest experience with mental and physical health programs and research. Section 7, experience with implementing successful digital learning programs. Further expand section 7 to include innovative public and non-public school experience. Expand section 8 to include serving on experience serving on a local board, and to create a new qualification, and that is for a Maryland resident who represents taxpayers and provides that perspective. And we would suggest that perhaps you could reduce section 8 from 2 members to 1 member to make that accommodation. We don't oppose the idea of the study. In fact, we're thinking about that very much ourselves as we bring up on board a new superintendent. We fully expect to do that, so we support that. What we do ask for the board to consider is encourage the selection of a nationally recognized entity. That'll bring a level of credibility and provide additional support for the superintendent as he or she, the new superintendent, is making changes. We would also ask that that consultant also not just list issues, but provide some solutions and some ways forward in terms of addressing any shortcomings that are identified. And the third thing that we would just ask is to harmonize and minimize the number of studies and reporting requirements that are currently being contemplated in various pieces of legislation. Mr. Chairman, I appreciate this opportunity to testify today. We support the bill, And this concludes my statement. The only other thing I'll just mention is, unfortunately, I'm currently receiving treatment for a prostate cancer diagnosis. I have to break in about, I got to break in about 10 minutes to get out of here and get up to the hospital for my next set of radiation treatment. I'm doing well, I'm fine. It's going very well, but I just need to be able to go do that. Again, thank you very much for the opportunity.
Well, health comes first, President Crawford. So leave whenever you have to leave. Don't cause anxiety because we're worrying about traffic. So we understand that, and our thoughts are with you. First question is from Senator Riley. Senator Riley, you're on.
Thank you very much, Mr. Chairman. Mr. President, effective date of the bill, is this something that needs to be pushed forward quickly as an emergency bill?
It is an emergency bill. Thank you for that reminder, Senator. And it would be effective July 1.
Very good. Now, or sooner, I guess.
I'm sorry, it's an emergency bill, and then the changes would take place for the July 1 appointments.
Very good. Mr. President, last question. We've had some discussion with private companies, and I put in a bill, Senate Bill 941, to talk about continuing virtual schools, but on a statewide basis. As we know, virtual schools today have been handled by individual counties. I would encourage the discussion by your bill and by that committee that's being assigned to see if there's a space in our state for a virtual school that goes past the artificial boundaries of county and have virtual schools that represent students at the same time from all the different areas of the state. That's more of a comment than a question.
Yes, isn't that so? Thank you.
Isn't that so, Mr. President?
Senator Riley. Senator Carrozza.
Thank you, Mr. Chair. Thank you, Mr. President. I know that you have given a lot of thought into proposing this legislation, and my brief question would be, would just like a better understanding from you on the role of parents with this new legislation and overall in this transition.
It's a great question.
So I'm going to turn off the video for a second.
Senator Riley, I think you may be on, need to mute.
Senator Riley, can you mute, please?
There.
No, just mute if you would.
There we go. Excellent. Yes, Senator Cruz. So as a parent myself, I think, look, this is crucial. I think it is always a balance, and there is no such thing as a perfect bill, right? Every bill could always be improved in various ways. I think we had conversations about parents. This gets very difficult because how do you accurately reflect 900,000 kids with one parent? Certainly that would be a preference and priority. I think there's the issue of becoming too narrow. The more constrictions to too narrow, it makes it harder to find people that are willing to serve in that capacity. The wider then the expertise or the desire for that expertise kind of gets diluted so much that you don't actually get it. And so certainly open to the ongoing conversation and leave to the judgment and wisdom of the committee how best to incorporate parent voice. And certainly I think having a parent on the board is a always a positive thing, particularly as a governor is making appointments to the board. I would imagine somebody that has their children in public schools would certainly be a good qualification to add.
Okay, Senator Kagan.
Thank you, Mr. Chairman. Mr. President, I am sorry that I missed the beginning of this conversation. I was reporting to the 911 board on our work on public safety. I just wonder two things. One is, does Chris Cavey, our appointment secretary, the governor's appointment secretary, say that these boxes are going to work? Because I tried to do something like this with our State Board of Elections to get better skills and the right folks in the right boxes. And he just said it's impossible, especially with the overlay of geographic, gender, and ethnic diversity. Is that, and it doesn't seem like that is mentioned in the bill. Can you just speak to those, please?
Yeah, I mean, I think that's a great point on that, especially the final point. That is not part of current law. Because normally we have it for most. If not, that makes sense. We certainly should have that as a component for the state board. I have not heard from Secretary Cavey directly. I understand the constraint. I do think as we look towards all of the pieces of the blueprint, there is a heightened importance for the Board of Education to have varied skill set and a consistency in that varied skill set, knowing all of the different priorities that we have for the system in the midst of transformation. And so I can understand where there is a logistical challenge. You know, we have 6 million people in Maryland. We're a great state. I suspect we have great people that would be willing to serve if we do the work to find them. And so, you know, I would respectfully disagree that it's too hard to do.
Okay, I'm with you, but that's
I hear
what
you.
I got back from him. One more follow-up. Have you given any thought to the idea of the president and the speaker appointing members, and so that it's not just the governor appointing members?
Yeah, I mean, look, I think that it's a really interesting question. I've certainly thought a lot about it. Obviously, there's an incentive there. Of course, board members of state board members are subject to Senate confirmation. So all of them go through Senate confirmation. So the Senate does have a role. Yeah, one of the issues is that ideally this is not everything we do is political at the end of the day, but with it is really important that there be continuity and sustainability and a real sense of a policy-focused decision-making for the state board. So we had toyed with the concept of adding in legislative appointments and pulled back because of we don't want to, this is not a political effort. This is not about who's in office now, who's in those positions now. This is about sort of the systems level. How do we set the system up to be most effective?
If I could do one last follow-up, please.
Very brief.
I will. Thank you, Mr. Chairman. That's related to the fact that the board members are the ones who hire, oversee, evaluate, and fire our state superintendent. And so I'm just wondering whether there's been any thought about that, is how we make that, that critically important appointment to be more representative and more accountable. Because my concern, don't you think, I'm asking a question, don't you think that just because the Senate has advice and consent authority at the beginning of someone's tenure, that 4 or 5 years later, when they vote on hiring or firing a superintendent, we really have a voice in that conversation?
I'd say the single most important job of the State Board of Education, without any question, is the hiring and firing of a superintendent. That of all of the varied responsibilities, the single most important thing is the hiring and firing. How that happens is very, it is both the important decision and consequential decision. And so doing it in the best interest of Maryland schools is the crucial component. I did forget to mention in my opening testimony that especially I do want to make it clear it's not necessarily about the individual people, but we are in this moment where we do know that the state superintendent will be soon departing. And so we're in the midst of a recruitment process for a new superintendent. So the timing of this is aligned. Point is well taken. Don't have a clear solution on that one at the moment.
I might want to talk to you about that offline.
Sure.
Thank you, Mr. President. Thank you, Mr. Chairman.
Yes, and obviously, once we take this bill up in committee, we can look at variations on a theme and address very important questions. Senator Simon Ayer, please.
Thank you. Thank you, Mr. President. I've heard good things from the state board, but I've also heard there's areas of improvement. So thank you for bringing this before us. And so with the veto override, I think it goes into effect 30 days or something like that. And just asking about the appointment process, because I'm not sure if this board has been appointed or how that timeline would work with getting recommendations from them. So if you could just, if you have any input on how the timeline would work with that.
No, great question. So the timeline that was initially laid out in the bill we passed in March certainly has a bit of timing wonkiness because of the override. And so there will be likely a subsequent piece of legislation that addresses some of those timing issues. The bill is enacted 30 days after the override, so probably in, I think it's 17 days or so, at which point the nominating committee for the AIB can be named. We are going to be working on that quickly. Then the nominating committee would then recommend names for the actual appointment of the AIB. The hope is that can get moving as quickly as possible. That accountability and fidelity to the plan is absolutely essential. So I think it's really important. We've passed a bill. None of it matters if we don't do it accountably and do it with fidelity. And so the faster we can get that AIB up and running and then working in conjunction with the state board, the better off we'll be in the long run. So that will be determined by the governor. The governor has the appointment authority. And so certainly that has to be, we have to be working in partnership to get that up and running.
Well, any help you need, let me know.
Thank you.
Thank you, Senator. Senator Washington, please.
Thank you, Chairman. Thank you, Senate President, for this bill. And I really appreciate when looking at the language used, because we wrestle with this. How do we balance sort of lived experience, that might be considered a demographic characteristics, being female, Black, LGBTQ, a business owner, with skill sets. And I think the way that this was tailored, has done a good job of doing that. And I think it's a good model, in addition to some of those recommended by the board chair. I'm a question about the AIB board. And just, I know this isn't the uncodified language, just talking about the implementation. But there had been some, I guess, conversation last session about those sorts of making sure that the board, the AIB board, had some similar characteristics. Is there contemplated at all that implementing sort of those types of characteristics to make sure that there's that representation in the board, in the AIB board?
In this particular legislation, no. But I will say it's a fair question. Why the AIB? One of the issues of sort of trying to do any type of transformation or restructuring is having some level of independence of the reviewer. So having an objective, independent, and that's why there is this relationship between the two in this bill. Certainly, I would hope that when the nominating committee is considering names and those that are forwarded to the governor for appointment, that these characteristics and experiences and expertise are considered in order to have a well-representative AIB board.
Mm-hmm. Well, I look forward to having an opportunity for us to be more intentional about some of that. And again, our committee is wrestling with how the best wording for those things, but the members are very much committed to that type of a clarity and that the legislature makes a statement about.
Certainly.
Doing that. So thank you again. This bill is great. Thank you so much. Thank you, Chairman.
Thank you.
Okay, thank you, Mr. Senate President. Seeing no further questions, and I believe there was no opposition, either oral or written, only a couple with favorable with amendments, and you've heard some of them from President Crawford. That concludes the hearing. Thank you for joining us, Senator Ferguson.
Thank you all so much.
Okay, we're now going to move to Senator Carter, 403, followed by Senator Augustine, 405. I have to testify in another committee, so the very capable vice chair is taking over chairing duties for the committee.
Thank you, Mr. Chairman. 403, Senator Carter, public institutions of higher education, incarcerated and formerly incarcerated individuals, academic and employment opportunities. Senator Carter will kick us off. Her lead proponent is Dan Alpert from the University of Maryland Student Government Association, followed by Zara Sadiq, Aisha Jamaluddin, and Daryl Carrington in that order. Senator Carter, welcome to EHE.
Thank you, Madam Chair, and good morning to all of EHE. It's a pleasure to be here. This bill is really, I think, a bright light that will bring us good feelings about what we would do if we pass it. The bill seeks to help formerly incarcerated individuals during the reentry process by creating increased opportunities for them to access academic programs and employment at the University of Maryland system. You'll hear more from my witnesses about this, but the impetus for this bill is worth mentioning. Students at the University of Maryland discovered the relationship between incarcerated individuals and themselves, that being actual chairs they sit in during their classes. As you're aware, Maryland Correctional Enterprises supplies, among many other things, furniture to University of Maryland. The students you're going to hear from today decided that the inmates who produce the furniture for their education should, at the very least, have access to the same opportunities they have themselves. So this bill has three major components. First, it would direct the Maryland Higher Education Commission to conduct outreach and information and disseminate information to incarcerated and formerly incarcerated individuals in order to inform them of the employment and education opportunities available at University of Maryland. Second, the commission would establish a preferential track for student applicants to University of Maryland who are formerly incarcerated. And third, the commission would establish a preferential track for applicants seeking employment at University of Maryland that are or were formerly incarcerated. Maryland is a proponent for strengthening reentry opportunities and reducing recidivism. This bill is a step in the direction where we can invest in reentry for those that are returning to our society that have contributed while they've been incarcerated. This bill allows for greater access to education and employment and emphasizes the sharing of information about these opportunities. For these reasons, I'd urge a favorable report.
Thank you, Senator Carter. Welcome, Dan Albert, University of Maryland Student Government Association.
Thank you. My name is Dan Albert, and I'm the student body president at the University of Maryland College Park. I'd like to start by thanking Vice Chair Kagan and all the members of the Education, Health, and Environmental Affairs Committee for the opportunity to share our thoughts on this important bill, as well as Senator Carter for introducing this legislation, which will improve access to employment and academic opportunities at Maryland's institutions of higher education for those who are currently and formerly incarcerated. In the state of Maryland, all state agencies are required to buy furniture from the Maryland Correctional Enterprises. The University System of Maryland accounts for nearly 20% of MCE's annual sales, which were more than $50 million in fiscal year 2019. At the same time, incarcerated people employed by the MCE make substantially less than the state's minimum wage. MCE employee salaries range from 17 cents to $1.16 an hour. At most, this is less than $10 per day. The fact that MCE workers are underpaid means that we have taken advantage of their labor during their period of incarceration. This is not only economically problematic, but also disproportionately impacts Black Marylanders. Maryland incarcerates Black people at a higher rate than any other state in the country. 70% of the state's prison population is Black, more than twice the national average, and more than twice the percentage of Black individuals in the state. To remedy this disparity, this legislation proposes a process be established specifically for formerly incarcerated individuals to apply for jobs at and admissions to public colleges and universities in the state. Included in this process is a requirement for outreach and assistance on the part of universities so that formerly incarcerated people can put forward their best application possible. While we believe that the current state of the prison employment system is unfair from a racial and economic perspective, we also understand its necessity and the positive opportunities it may provide toward reducing recidivism. Instead of terminating the relationship between Maryland Higher Education and the MCE, this will build a new relationship, one where formerly incarcerated people who worked for the MCE are welcome to our institutions of higher education and given unique opportunities to succeed. This legislation draws inspiration from universities across the country, including public institutions like Ohio University and UNC Chapel Hill, that offer specifically tailored programs for incarcerated people to earn a college degree, and Georgetown University, where the descendants of slaves once owned by the university are offered preferential admission. With a process that is catered toward their unique needs, we believe that those who are released from incarceration will have greater opportunity in re-entering the workforce and society. We recognize that a program as novel as this will require a lot of work, yet the services it provides will truly make a difference. For these reasons, we strongly urge the committee to issue a favorable report for Senate Bill 403. Thank you.
Thank you, Mr. Albert. Thank you for your testimony and thank you for your leadership at the University of Maryland. I'm a former student government geek myself, so not to call you a geek, sorry. I mean that as a compliment, truly. So good for you. Aisha John Luden from the Prison Resistance Project, you are next and you can speak for up to 2.5 minutes. Thank you.
Hello, my name is Aisha Jamiluddin and I'm a student at the University of Maryland. I'm here representing the Prison Resistance Project. a student activist organization that advocates for prison abolition and works to combat injustices in the criminal legal system. I'd first like to thank Chair Pinsky, Vice Chair Kagan, and all the members of the committee for allowing me the chance to speak today. I'd also like to thank Senator Carter for sponsoring this legislation, which will give admissions help and preferential admissions to formerly incarcerated MCE workers and help them get jobs with the university system. Incarcerated workers of MCE are paid a fraction of the state minimum wage, and the University of Maryland has been one of the primary beneficiaries of their exploited labor. As students, we've known for years that our chairs, desks, tables, and beds are created through prison labor. The furniture you all use at the General Assembly is made from prison labor as well. Yet, despite relying on their labor, we do nothing to support these workers. MCE workers usually leave prison with no job prospects, no education, and no savings. Those released from prison already face discrimination in the workforce, and incarceration makes it difficult for individuals to receive a college education. Many incarcerated people come home to poverty with little opportunities for a stable future. In 2017, only 1% of the US prison population had a bachelor's or graduate degree. Over half of the people recently returning from prison are unemployed. This majorly contributes to their likelihood of being reincarcerated. As of 2018, 40% of returning citizens to Maryland are rearrested within 3 years. We also must remember that over 70% of Maryland's prison population is Black, compared to 31% of the state. There's no question that our prisons systematically oppress and exploit Black people for their labor while robbing them of future stability. Through this bill, our university system can allow for formerly incarcerated people to attain some stability once they're released from prison. This will not only contribute to their well-being, but the well-being of their families and communities. This is the very least that we can do. And while we strongly support this bill, we want to recognize there should be programs like this for all incarcerated people, whether or not they've worked for MCE. We also must recognize that this bill primarily benefits those who are released from prison, while little is done for those still incarcerated. If we wish to end our state's and our country's commitment to mass incarceration, we need to recognize the humanity of those within prisons and work to substantially decrease the prison population. Therefore, we strongly urge you to give a favorable report to this bill. Thank you for your time.
Thank you very much. Really appreciate your testimony. Zara Siddiq, again, you have up to 2.5 minutes. Thank you for being here.
Good afternoon, everyone. Excuse me. My name is Zara Siddiq, and I'm president of NAACP, where we work to inform youth of the problems affecting minorities and to advance the economic, education, social, and political status of minorities and their harmonious cooperation with other peoples. I would like to thank Chair Pinsky and all the members of the Education, Health, and Environmental Affairs Committee for the opportunity to share our thoughts on this important bill. I'm speaking to you today to express my support for SB 403. It is time that we acknowledge the hypocrisy of our system and shed light upon incarcerated people's education and rights. According to the Maryland Correctional Enterprises Annual Report in 2019, incarcerated people's pay ranges from 17 to 36 cents an hour for a 4 to 5 day work week. According to the Baltimore Sun report in 2019, the Black Maryland prison population exceeded 70% in 2018, compared to the 31% in the state population. These facts inevitably prove that the MCE is taking advantage of incarcerated and already marginalized people's labor. I'd like to point out that the feedback given to students, staff, and elected officials from incarcerated peoples have been positive towards the MCE regarding the opportunity to work certain jobs that give them the ability to pass the time and to earn wages. Due to this fact, I believe it beneficial for us to further aid incarcerated people's situation in providing them education and a better opportunity to start their lives after time has been served. Enacting this bill allows us to follow in the footsteps of other institutions to see the hypocrisy as well, such as Georgetown University, who is giving preferential admission to descendants of slaves who are sold by the university, as well as faculty, staff, and alumni. In a state where we have the highest rate of Black people incarcerated, systemic inequality needs to be addressed. This bill takes a step towards remedying this issue, which is why I'm asking you to vote yes on SB 403. Thank you.
Supported. Thank you very much, Ms. Siddiq. The fourth witness is Daryl Carrington. Mr. Carrington, I think the first 3 young witnesses have set quite the high bar. So we're glad to have you here. You have up to 2.5 minutes.
Thank you, Madam Chair and members of the committee. My name is Darrell Carrington. I'm here on behalf of Carrington and Associates and also my client First Financial Mortgage. And you are absolutely correct, Madam Chair. I can't come close to testifying as well as those before me. I'd like to thank Senator Carter for putting in this very important bill. One of the things that we like to do at First Financial is to give back. We've developed a financial literacy course that we offer to returning citizens. We offer it free to veterans as well. But more importantly for this conversation, we believe it's really important to ensure that once folks have served their time, that they have the opportunity to regain society and gainful employment. Certainly after spending so much time working for a enterprise that's serving other state agencies, they should be able to use those skills in terms of advanced placement and with regard to placement in our institutes of higher education. But we would also offer that we should have apprenticeship programs for industries such as ours, which is mortgage financing. I mean, we have a lot of positions in which your status as a returning citizen will not affect your ability to be able to get into the industry. And we have figured salaries in the industry. So thank you very much, Senator Carter. And thank you to the members of the committee for your consideration. And we hope that you can give us a favorable report.
Thank you, Mr. Carrington. Before we see if there are questions, I just want to flag for colleagues that in addition to the 4 witnesses we've heard and Senator Carter, Kobe Little from the NAACP, Bernie Sadusky from the Maryland Association of Community Colleges, and the University of Maryland, Barry Perg, the Public Interest Research Group, all submitted favorable testimony, and the University System of Maryland submitted informational testimony. There was no opposition other than that. So colleagues, are there any questions? Seeing none, Senator Carter, thank you for this really good bill, really interesting, very thoughtful.
I'm sorry, I have a
Raise your
question.
hand. Yes, please.
Sorry about that.
No, you're good.
Okay. First of all, I want to, having weird feedback. I want to thank Senator Carter. Thank you for this bill. We have another bill on the issue of MCE. And it is interesting that we're addressing how to, in some form of reparations, which it seems like a very minor form. But mostly I wanted to speak to the young people. I've just have noticed that over the last 4 years, especially college students and students in your generation focusing on not just criminal justice, but also the prisons. And I really believe and take heart of you're really identifying what it means to be an ally. That it's not simply enough to just say that you're an ally, but you're clearly working at ways to undo your own privilege. And the fact that, recognizing that we get cheaper prices, that you are benefiting from the labor of exploited people and having a willingness to give up that privilege is the definition of what we need to be looking forward to in our policy. In our advocacy. And so I thank you very much. I appreciate that very much, Senator. I did have a question to Senator Carter or the bill about how it would work in choosing MHEC to facilitate it and MCE itself.
The Maryland Higher Education Commission.
Sorry, thank you, Maryland Higher Education. Could you speak to the choice of those two entities? Was there a contemplation of the broader system board and the Department of Corrections, or is this just specifically? Yeah, could I just ask a question about that?
So I first want to say that I take full responsibility for the bill, the legislation, and the language, but I took an idea that came from the students and I got it put into legislative form. That being said, it seemed reasonable to me, but I understand that this committee is the experts dealing with these educational issues. And so certainly willing to tweaks if you, in your wisdom, you think that it should be broadened to the full Department of Corrections or to the, or beyond the Maryland Higher Education Commission.
At least a part of it. So I'd love to talk to you about it because I think it would be interested in this, and I'd be interested in seeing how we could amend it to make sure that the responsible parties are really part of this group to make this happen. So thank you so much for that. And again, thank you for bringing this bill.
Thank you.
Thank you, Senator Washington. I see no other hands raised. Seeing that to be the truth, then that completes the hearing on Senate Bill 403. Thank you, Senator Carter and witnesses. Great job. The next bill is Senate Bill 405. Senator Augustine, it's great to have you back in EHE. Always good to see you. You have a bill, higher education student ID cards, required information. Your witnesses will lead off with Emily Allen from the Mental Health Association of Maryland, followed by Ashley Hawkins and Lauren Ashley Daly. Senator Augustine, you may begin.
Thank you, Vice Chair Kagan and members of the committee. Senator Malcolm Augustine here on behalf of Senate Bill 405, Higher Education Student Identification Cards, Required Information. Colleagues, this bill would require that student IDs at Maryland institutions of higher education include the phone number for the state crisis hotline. This would ensure that life-saving information is at a college student's fingertips if they are experiencing a mental health crisis or may be contemplating suicide. By way of background, state law already requires that the phone number for Maryland's helpline, administered by the Maryland Department of Health, be printed on student ID cards for public middle and high schools. This bill would expand that requirement to include institutions of higher education in Maryland. Several colleges in Maryland, including the University of Maryland, College Park, and Baltimore County, already include a phone number for a suicide and/or crisis hotline on their student IDs. This bill would ensure that all college IDs include this information. Several other states have enacted laws to require colleges and universities to include a suicide and/or crisis hotline on student ID cards, including California, Kentucky, Washington, and Wisconsin. In all of these states, the respective bills passed with overwhelming bipartisan support. Now, this bill would be required to include the phone number for Maryland's helpline, and we'll also make sure that it's available 24 hours a day, 7 days a week to callers in need of crisis intervention, risk assessment for suicide, homicide, or overdose prevention, support, guidance, information, or connection to community behavioral health providers. It's available by calling 211 or by texting your zip code to 898-211. Under the legislation, institutions of higher education may also choose to include on student IDs the phone number for the National Suicide Prevention Lifeline, the crisis text line, and/or an on-campus crisis center. The bill would not add additional costs to institutions of higher education, as they would not be required to reprint ID cards in order to comply with the law. Rather, colleges and universities can add the hotline number when new ID cards are printed for incoming freshmen and transfer students. Members of the committee, according to the Center for Disease Control and Prevention, suicide is the second leading cause of death among college-age Americans. Unfortunately, suicide rates have increased in Maryland by between 6 to 18% over the last 20 years. This line will help in times of mental or emotional crisis. Roughly 1 in 4 people who contacted the crisis text line are college age, and more than 30% of texts to the hotline are about school. In spite of these efforts, too many young people in Maryland have been committing suicide. Thankfully, available research suggests that talking openly about suicide may reduce the risk of suicidal thoughts. The pandemic and economic crisis have taken a heavy toll on people's mental health. Increased social isolation, unemployment, income insecurity, food insecurity have negatively impacted mental health. To make matters worse, job losses have left many Marylanders without the health insurance needed to cover mental health counseling and treatment during the pandemic. College-age Americans have been especially hard hit, according to the CDC. 25% of respondents seriously considered suicide in the last 30 days. So this is a very serious problem. High prevalence of depression, anxiety disorders among college students continues to be the case. We do have, you should have a sponsor amendment because we met with stakeholders across in the interim, which is how we kind of crafted this bill. But we did include as well in a sponsor amendment that's how we came up with the sticker, the consideration amendment. But we also, in working with the folks, provide some flexibility that says that it's on a campus crisis center that operates 24 hours a day 365 days a year. If the card has that information, that will be sufficient for this legislation. And that they may include the National Domestic Violence Hotline, just trying to emphasize the importance of that important piece of information as well. Ensuring the students who are in crisis have access and a reminder of the resource that we have available is the purpose of this bill, and I ask for a favorable report as amended.
Thank you, Senator Augustine, for your testimony. Your lead witness, Emily Allen from the Mental Health Association of Maryland. Ms. Allen, you have up to 5 minutes.
Thank you. Thank you, Madam Vice Chair, members of the committee. My name is Emily Allen. I'm the Public Policy Associate at the Mental Health Association of Maryland, here in support of this bill. The COVID-19 pandemic has had a significant impact on mental health and suicidality, both in Maryland and across the United States. Between April and July of 2020, during the height of our lockdown protocols, calls to Baltimore's crisis hotline Here to Help nearly doubled. And as of September, the number of callers threatening suicide was 5 times as high as the beginning of the pandemic. Death by suicide in Maryland has been on the rise over the last 2 decades, and it's a particular concern with our young adults. As of 2018, it was specifically the 3rd leading cause of death for those between the ages of 10 and 34 in Maryland, and it captures many of our college students. We know that students face significant stress. The specifics are in my written testimony, but through a national survey of nearly 68,000 students in the US in 2019, half reported overwhelming anxiety or that things felt hopeless. A third felt so depressed that it was difficult to function, and 11.6% had seriously considered suicide. Active Minds surveyed 2,000 students in April of 2020 during the pandemic, and 55% of them said they wouldn't know where to go if themselves or a friend were experiencing a mental health crisis. By adding the crisis hotline information to the back of our college ID cards, we can provide a quick and easy access to life-saving resources that are available 24/7 for our students. This is especially impactful for students who are attending colleges where the on-campus crisis center either has limited hours or they're closed over the summer. The hotline's also trained in crisis intervention, suicide risk assessment, and overdose prevention, which some of the on-campus centers may not be. And they can also provide crucial connections to community behavioral health providers that also those crisis crisis centers may not have access to. And as the senator stated, Maryland already requires that the number be listed on the back of the ID cards for our students in grades 6 through 12. And it's time that we create a similar requirement for our colleges. Thank you so much for your time, and I urge a favorable report on SB 405.
Thank you very much, Ms. Allen. Ashley Hawkins, University of Maryland Student Government Association. I love that University of Maryland Student Government is present today. So welcome.
Thank you so much for having us. Yes, I am Ashley Hawkins, and I am a member of the Student Government Association at the University of Maryland College Park. I'd like to start off by thanking the chair and all of the members of the Education, Health, and Environmental Affairs Committee for the opportunity to share our thoughts on this bill, as well as thanking Senator Augustine for introducing the legislation, which will ensure that all USM students have access to essential mental health services at all times. I would not be able to provide this testimony if not for the mental health services provided by the University of Maryland. As a freshman, I sought help from both our counseling center multiple times and had to wait 3 weeks for an appointment due to the lack of immediate available sessions. After receiving aid from both the counseling center and the health center's behavioral health services, my grades went up, I became more involved on campus, and I felt more empowered to succeed. During the 2018-2019 academic year, the UMD Counseling Center saw almost 10,000 students. And as the lack of the available appointments indicates, I was not alone in my struggle. As we entered this fall semester, data from our university highlighted that students felt more alone and were showing more signs of depression. Our counseling center has made modifications to increase appointments availability, but the reality is that the counseling center alone cannot respond to the mental health concerns of all the students. This bill protects the health and safety of students by providing them with easy, accessible mental health resources via the Maryland Crisis Hotline. By placing this number on the ID cards that are distributed to every institution ensures that students have the necessary help in a vulnerable moment. We also urge the committee to follow the lead of California and Kentucky state legislatures by including the National Domestic Violence Hotline and the National Sexual Assault Hotline in the optional numbers that institutions may provide. In order to best serve the campus community, all students need access to essential crisis services. And so it is for the health and safety of all USM students that we, the Student Government Association at the University of Maryland College Park, urge favorable report on the Student Identification Cards Requirement Information Act.
Thank you very much, Ms. Hawkins, and thank you for sharing your personal story. We're so glad you're good and active and thriving. So thank you for being with us. Lauren Ashley Daly, Johns Hopkins, welcome to EHE. You have up to 2.5 minutes.
Thank you, and good afternoon to the chair and to the committee. My name is Lauren Ashley Daly, and I'm a graduate student at the Johns Hopkins Bloomberg School of Public Health, where I am a Master's of Public Health candidate. And thank you so much for having me here today to speak to you all about why I favorably support SB 405. Young adults in Maryland and across the nation are in the midst of a mental health crisis, and this has been on the uptrend for years, but has only been exacerbated by the COVID-19 pandemic. There are several factors that contribute to a student's stress. I know for myself, as an undergrad and graduate student, attempting to balance classes, studying, leadership positions, and research assistantships were challenging enough without also having to navigate my feelings of culture shock, homesickness, and self-discovery. And I know my experience was privileged since I also did not have to worry about dependence, housing, food security, or tens of thousands of dollars of student debt piling up each term. Students are so overwhelmed trying to coordinate between all of these wonderful but taxing opportunities that college life provides that it's not until they reach their breaking point or have a moment of peace during vacation periods that they can really take stock of what their hard work and tenacity is doing to their mental health. And while on campus, students may have access to resources and community that they can go to when they need assistance, a student doesn't stop having those behavioral health needs when they're off campus, and that's really the concern here. Through SB 405, instances of higher ed will be mandated to provide a crisis hotline that Maryland students can call at any time, any point in the year, and someone will be there to listen and give that individual the support that they need. Experts in mental health are signaling that even as the threat of COVID-19 abates, our nation is in the beginning of a mental health epidemic as people continue to deal with the economic uncertainty, isolation, and the loss of life, the latter disproportionately felt by low-income Black, Latinx, and Indigenous communities. 2020 was marked by increases in anxiety, depression, and stress-related trauma amongst all adults. But what is striking is that in studies done by the CDC, 18 to 24-year-olds were disproportionately represented alongside essential workers and those reporting suicidal ideation. News reports and research have shown that while young adults are at some of the lowest risk for COVID, we are feeling some of the heaviest social losses with canceled milestones like graduations, uncertain futures, and seismic shifts to our education paradigms. I, for one, have not stepped foot into any Hopkins campus since starting my program in July, and that will likely be the case when I graduate this May. This all isn't to say my age group is not resilient and we are not willing to do our part to put an end to this pandemic, but that does not mean that we do not deserve support. Now, addressing this crisis during COVID and after will not be solved in one piece of legislation at any level of government, but by
Haley, if you could wrap up, please.
Absolutely. By improving mental health services, by mandating the crisis hotline onto higher ed ID cards, we can literally put in the hands of students a resource to improve their mental health. Thank you.
Thank you so much for being with us, and thank you for all that you are doing on campus. I'm so inspired by the young people and their testimony. Colleagues, are there questions for these talented witnesses? Okay. Seeing none, Senator Augustine, witnesses, thank you so much for being with us today. That completes the hearing on Senate Bill 405. Stay safe, you guys. The next bill is Senate Bill 548. This is a very thick folder. I think I can't even lift it. Public Schools, Centers for Disease Control and Prevention Surveys, revision. Senator Augustine, you will lead us off, followed by Claudia Remington, Margot Quinlan, and Jeffrey Edwards. You may begin, Senator Augustine.
Thank you, Vice Chair Kagan, members of the committee, Senator Malcolm Augustine here on behalf of Senate Bill 548, Public Schools Center for Disease Control Prevention Surveys revisions. I'm grateful that Maryland participates in the Center for Disease Control's Youth Behavior Risk Surveys at the middle and high school level that helps Maryland set public health policy. Right now, the department may omit significant portions of the CDC Youth Risk Behavior Survey at their discretion. This bill establishes that the department shall include the CDC YRBS questions associated with adverse childhood experiences. It does not take the power of the department away from choosing to not collect data from other questions. What it will do is provide a complete data set for public health policy on a set of conditions that are empirically proven to lead to negative somatic and behavioral health outcomes. It also requires the department to provide a state and county summary and trend reports on the data within 6 months. You also should have a sponsor amendment that asks that the information be disaggregated by race, gender, and ethnicity. Adverse childhood experiences are potential traumatic events that occur in childhood. ACEs can include physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, exposure to domestic violence, household substance abuse, household mental illness, parental separation or divorce, incarcerated household members. Toxic stress from ACEs can change brain development and affect how the body responds to stress. ACEs are linked to chronic health problems, mental illness, and substance misuse in adulthood. If you look at the data we do have from Maryland YRBS, it is absolutely sobering and demonstrates how much work we have to do on addressing the impact of ACEs. As Vice Chair Kagan mentioned, there is extensive written testimony in support of this. There is some limited opposition testimony. And what I would say to what is there is that I think that we should resist the idea that gaining this information would create stigma. The reality is that this is what our kids are living with, and we must know what is going on in order to address the associated negative health outcomes. Now, with regard to the letter of information from the department, the cost consideration versus our public health outcomes are not even on the same scale. Management of the questions and times can and should be managed. CDC provides some flexibility for the non-ACEs questions, and I really think that this is something that they can absolutely manage. You will hear from the panel how important it is that we have a complete data set of ACEs data to work with to help us set public policy at the local, state, and to help with the federal level. I'm asking for your favorable report with sponsor amendment.
Thank you, Senator Augustine. Leading off our proponents is Claudia Remington, the Maryland State Council on Child Abuse and Neglect. Thank you, Ms. Remington. You have up to 5 minutes.
Good morning, good afternoon, Vice Chair Kagan and members of the committee. My name is Claudia Remington. I'm the Executive Director of the State Council on Child Abuse and Neglect, SCAN. SCAN is a multidisciplinary advisory body that makes recommendations to the Governor and General Assembly and has spent a decade participating in technical assistance from the CDC and advocating for a statewide plan to prevent and mitigate ACEs. SCAN strongly supports SB 548 that requires MSD to include the CDC's ACE questions and positive childhood experiences module into the YRBS. I refer you to the appendix on page 158 of our written testimony for the current CDC. Yes.
Before you keep going, YRBS, if you can just try not to use acronyms, if you can translate everything, that would be so helpful.
Sorry. The youth risk, the youth risk behavior survey. I refer you to the appendix on page 158 of our written testimony for the current CDC ACE module. We know that ACEs have significant short and long-term physical and mental health consequences as demonstrated by the original CDC ACE study and multiple other replication studies. I refer you to the pie chart on page 26 of our written testimony to look at the staggering percentages of a wide array, just a sliver of health and social problems that are attributable to ACEs. For example, epidemiologists estimate that 78% of IV drug use, 67% of alcoholism, 66% of suicide, 20% of unemployment, 25% of job injury and illness, 61% of incarceration, 69% of severe and persistent mental illness, and 62% of homelessness are caused by ACEs. The total cost of treatment for these exposures is estimated to be in the hundreds of billions, much of which is borne by state Medicaid programs. Maryland Behavioral Risk Factor Survey, or the BRFIS, has collected data on ACEs among adults and confirmed that ACEs are very common in adults, and that there is frequently a dose-response relationship between the number of ACEs experienced and the likelihood of adverse physical and mental health outcomes. While it is important to know the extent to which Maryland adults have been affected by ACEs, it's difficult to use this data to prevent ACEs or mitigate their negative effects. ACEs, because they're identified that may have occurred decades ago. In contrast, the YRBS gathers data from middle and high schoolers, and the ACEs have occurred much more recently. This provides Maryland with important usable data to prevent and mitigate ACEs, including these questions in the Youth Risk Behavior Survey, and also allow policymakers and local communities to do several things. First, to understand the extent to which youth are exposed to ACEs by jurisdiction, gender, race, and ethnicity. Second, to compare data over time to assess the extent to which prevention efforts are reducing ACEs. Third, to examine information about which communities and groups are most affected by ACEs, enabling effective and equitable distribution of resources and services to those at greatest risk. Fourth, to understand the associations between ACEs and risky behavior and adverse health and social outcomes in order to develop effective prevention and mitigation efforts. And finally, to examine how positive childhood experiences might be effective in reducing the negative impacts of ACEs. In 2018, Maryland was the first of 2 states to collect 4 ACE questions and 2 positive experiences questions in the YRBS. The 2018 data is illustrated in the graphs and jurisdictional maps on pages 3 to 6 of our written testimony. From over 41,000 high school students surveyed, the data shows that identified ACEs varied significantly from county to county. For example, anywhere from 17.3% of students in Howard County to 32.4% of students in Carroll County lived with someone who had a substance use or gambling problem. 26.4% of students in Howard County to 37.2% in Dorchester County lived with someone with depressed, mentally ill, or suicidal. 16.3% in Howard County to 30.4% in Dorchester County reported emotional abuse by a parent or other adult. For every ACE category, students who experience ACEs were significantly more likely to exhibit risky behaviors: drug and alcohol use, depression and suicidal ideation, physical fighting or carrying a weapon to school, texting and driving, and obesity. The data in Howard and Montgomery counties routinely showed lower prevalence of ACEs, while in Western Maryland, the Eastern Shore, Baltimore City showed a greater prevalence of ACEs measured among high schoolers. Data also showed that the positive impact of having supportive adults varied by county. The presence of between 1 and 3 supportive adults reduced the likelihood that a teen had planned a suicide attempt, depending upon the county. This suggests that mentoring programs may be, I'm almost finished.
Okay, you can wrap up, please. Thank you.
This suggests that mentoring programs may be an effective mechanism for reducing the negative effects of ACEs. For these and other reasons found in our written testimony, SCAN urges a favorable committee report on SB 548.
Okay, Remington, take a deep breath. That was very impressively speedy and comprehensive. So thank you very much for your testimony. Margot Quinlan with the Mental Health Association of Maryland, you have up to 2.5 minutes. Welcome.
Great. Thank you, Vice Chair, members of the committee. My name is Margot Quinlan. I'm the Director of Youth and Older Adult Policy at the Mental Health Association of Maryland. We are happy to be here again, supporting Senator Augustine and his leadership on this really important issue to address adverse childhood experiences, or ACEs, in our state. And this bill, as has already been said, will really just help deepen and I think enrich our understanding of where and how ACEs are impacting students across Maryland's counties, to really help us better support targeting resources and advocacy to support those youth in high school. It really does this by establishing procedures for administering this youth risk behavior survey and youth tobacco survey. So the YRBS is this risk behavior survey that gives us survey level data across Maryland's counties, which is what Ms. Remington was speaking on. The YRBS currently collects survey level data on mental health, including things like suicide and depression, substance use and tobacco use, and risk behaviors such as personal safety, bullying, and violence. And it includes several ACEs questions as well, these adverse childhood experience questions, and has helped demonstrate a strong relationship when it comes to the exposure to ACEs and engagement in youth risk behaviors, as well as other social, emotional, and behavioral challenges. According to the 2018-2019 high school YRBS youth risk behavior survey, about 1 in 2 Maryland high school students were exposed to these measured ACEs, which have been found to have a direct impact on the normative development and lifelong health of individuals, as we know that trauma can affect a child's brain and delay certain development, which just makes it harder for them to concentrate, study, really thrive and succeed in school and in life. and it has these, very deeply impactful long-term impacts. Their ACEs are a significant risk factor for mental health and substance use disorders, as has been said, and also really can hamper and impact prevention and treatment efforts as well. SB 548 also really helps support the Department of Health in publishing this much more robust report on the challenges faced by our state's middle and high school students. We believe that would help to just better allocate resources and treatment interventions across the state, and just overall better support, help us to all better support young people in their development. So for these reasons, and for those already said, the Mental Health Association of Maryland would urge a favorable report on this bill. Thank you so much.
Just under the wire. Thank you so much, Ms. Quinlan. Mr. Edwards, Jeffrey Edwards from the Johns Hopkins Bloomberg School of Public Health. Welcome, Mr. Edwards.
Thank you, Madam Vice Chair and the EHE Committee. My name is Jeffrey Edwards, and I urge a favorable report on SB 548 regarding the required inclusion of questions surrounding adverse childhood experiences, or ACEs, and positive childhood experiences in the CDC Youth Risk Behavior Survey, or YRBS. As a medical student at the Stanford University School of Medicine, applying into pediatrics, and a Master Public Health student currently at Johns Hopkins Bloomberg School of Public Health, I have knowledge in these fields that informs my support of this bill. In particular, I've worked with Senator Augustine's office to establish a working relationship with Dr. Nadine Burke-Harris in the Office of the California Surgeon General, which was created to implement their innovative ACEs Aware initiative. Since their office was created in 2019, they've implemented statewide ACE screening programs complete with provider training, reimbursement for screening, and cross-sector collaborations to provide effective interventions after screening is complete. In order to build out such an extensive program, however, we must start with evaluating Maryland's current situation and determining how we will work towards the goal of reducing ACE burdens for the next generation of Maryland residents. Some of these health effects that we know from ACEs happen as early as infancy, with high adversity in infancy associated with growth delays, sleep disruption, and developmental delay. Children with high ACE burdens are also more likely to experience frequent viral infections, pneumonia, asthma, and other physical health conditions, in addition to the mental health impacts. Simply put, ACEs have broad effects on all of our health, from childhood to adulthood. And we must do now is work to take the first step towards understanding Maryland's current situation and collect high quality and consistent data on which ACEs are occurring and where they are happening most frequently. By requiring the YRBS to include these questions on ACEs, and by requiring data disaggregated by gender, race, and ethnicity, we can better target prevention efforts and allocate resources for mental health support where they are most needed. Senate Bill 548 accomplishes those goals, and as such, I urge a favorable report on the bill. Thank you.
Excellent. Thank you very much, Mr. Edwards. Good luck with your education. We've had a lot of wonderful young witnesses today. Thank you, Senator Augustine. I have some questions. It appears that at this moment, my hand is the only one raised, so I will start it off, and then colleagues, you can follow if you like. And this is, Senator Augustine, this is for you or for any of your witnesses. And first off, colleagues, I do want to flag that there are 237 pages of testimony in your file. So when I said that this was a weightlifting exercise, I meant that. So you might want to check that out. I also want to mention that we have written testimony from Advocates for Children and Youth, MSPA with no acronym spelled out. I don't know what that is. The Montgomery County Board of Education, informational from the Department of Health, favorable from the Psychological Association, the Coalition to Protect Maryland's Children, Behavioral Health System of Baltimore has an amendment, and a bunch of other acronym type people, along with the state teachers, No More Stolen Childhoods, and NARAL Pro-Choice Maryland. So just to give you an idea of the range of folks. So Senator Augustine and witnesses, you get this data. First question. First off, self-reporting. I don't want to get anyone in trouble. I don't want to fill out the form accurately. My parents will be mad at me. And I saw the verbiage on confidentiality. The parents get informed, but they don't get to see it, all that stuff. How do we know how accurate the self-reporting is? And then the more urgent question is, what do we do with it? So we find out that there are huge problems in abuse and separation, divorce, mental health, suicidal ideation, domestic violence at home. Then what? Because it's disaggregated from the name. So it's not that the Smith family is having problems at home. it's, 13% of the fourth graders at Bell Elementary are having these issues. Can you guys just speak to that, please? And again, I toss that out to Senator Augustine or any of your witnesses.
Thank you, Chair, Vice Chair Kagan. I'm happy to allow Ms. Remington to respond to that. I would say, actually, I'll just let her respond. I'm more than happy to do so, but I'll let her respond to it.
So I think there were a lot of questions all put together there. First of all, this is a survey data, so it's nobody knows who, the students don't put their names on it. Nobody knows who filled out the form. So this is really for a public health perspective to be able to look at the prevalence, not the incidence, but the prevalence of adverse childhood experiences within local communities. And other communities have used this data to help to prevent and ameliorate. So you can't, if a student already has an ACE, you can't take that ACE away. Many kids are born with a couple ACEs because of a parent that has a substance use problem or whatever, a mental health problem. So they're born with an ACE. But you can lessen the number of ACEs by these positive childhood experiences, which are also included in this ACE module. So how many caring adults other than parents children have in their lives have been shown to reduce the number of ACEs a child has and the cumulative impact of ACEs. So having communities understand what the prevalence is in their local community really allows them to design programming to affect that. So for example, in the questions that we asked in Maryland in 2018, local communities asked the health department to disaggregate that, to do their particular jurisdiction. And in Frederick County, it was if a student had 3 or more caring adults, they had that impacted whether or not they had risky behaviors dependent on those ACEs. So the larger number of caring adults they can create in a child's lives, the less likely the kid is going to have negative impacts of those ACEs. And so local communities, there's an ACE initiative in Frederick, and they were very excited to see this. They also creating programs that really provided the supportive adult in kids' lives would help. They've done this in Monroe County in New York, and communities really realized, we knew we had a problem with suicide, but we didn't know what to do about it. And when they saw that their numbers, as the number of caring adults in life of that child went up, then even if they had a number of ACEs, their chances of committing suicide or having suicidal ideation went down tremendously. So this is how it will help communities understand. And as far as the questions, I know,
yeah, go ahead.
As far as reporting around criminal, like sexual abuse, this is, you will not know what student had sexual abuse. So it will not create, first of all, a stigma for a certain child, nor will it be reportable, because we don't know which students are. It's really a matter of understanding the extent of the problem from a public health standpoint and being able to develop interventions to respond effectively, community by community. Hope that answers your question.
Chair
certainly is.
Kagan?
Yeah, go ahead, Senator Augustine, briefly though.
Yes, very, very briefly.
Yes.
The efficacy of this survey data has been reviewed. This is not something that's new. It's been going on for some time by the CDC, and they have tested for the efficacy of the data of their program. And the kids, they've gone back and tested it. The kids are actually truthful, have been truthful when they've gone back and tested it. in part because it is anonymous. And so they are able to do that. And then we have been able to establish public health policies and programs based on, as Mr. Remington was saying, based on this information. And so that's why it's so important from a public health standpoint. There is another part that they are working on, which is really dealing more on the patient level. That is happening as well. So this does help us with that, but that's for another bill.
So, Senator Augustine, I'm totally sold that there are kids who are struggling, that there are families that are broken, that there are kids who are being abused. Like, I totally get that. What's the trigger number? Because in every single classroom, in every jurisdiction of any demographic, anywhere in the state, there will be X percent of kids who are having adverse childhood experiences. It's very weird that it's ACE, because normally an ACE is a good thing. So this is a negative ACE. So they're having an adverse childhood experience, but is it 5% in a classroom or in a jurisdiction is okay, but 6% is not? Is it 15? Like, where's the trigger? And we're still going to leave some kids unaddressed or not.
So the way that I would address what you're saying with that, Senator Kagan, is that we would like to reduce or cut. So for example, California has set a goal to cut ACEs in half in a generation because they're aware of the outcomes that come from high levels of ACEs. So for example, similar to our desire, a good one to think of is lead toxicity, because a lot of times the neurotoxicity associated with ACEs is pretty similar to that which happens with lead, where we establish a goal, we realize what the lead problem is, we do that by testing, finding out how many kids have it, and then we start to develop policies around that to reduce lead amongst our kids because we know what the impact is. This is very similar to that, but the first step is to know exactly what we're dealing with, and then we can also see the efficacy of our efforts along the way.
Senator Hester has a question. Thank you, Senator Augustine. I appreciate that.
Thank you, Senator Augustine. This is a really, you're such a great champion for this issue. I was quickly reading through the 200 some pages of testimony, and I love the data and I love the maps in there. My question was just about the actual survey, because at one point I saw that it looked like that Maryland had done the survey, and then I saw somewhere else that we weren't doing enough. So can you be really specific about what we need to do and maybe this 99 question limit or something?
Yeah, it's not that we aren't doing the survey. As I started out with my testimony, we are doing the survey, which I am grateful for, because we are collecting the data, but our data set is incomplete. So what we're trying to do is say, let's make sure that we ask these questions so that over time, in a longitudinal, just like any kind of research, we have a better baseline of data on these things which we already know are the sources of these long-term problems. And so that's what we're trying to say. We're in the same way that right now the statute provides flexibility to MDH with regardless of these questions. So now we're saying, okay, these are so important based on the information that we have, that we really need to have a complete data set with these questions.
So just if I might, one quick follow-up. The other leading states are doing in this area to really address this? They're asking for the complete data set.
Oh, absolutely. Yeah.
Okay.
Because with the complete data set, you're able to establish that longer term public policy. Right. And we're able to track it over time. And we know that, and then we can also start to establish those goals for trying to reduce them.
Excellent. Thank you.
Thank you, Senator Hester. Senator Augustine. I see no other hands raised. I think this is a really interesting bill. I look forward to the conversation and to a lot of bedtime reading here, Senator Augustine. Thank you to the witnesses. Seeing no other questions, that completes the hearing on Senate Bill 548. Colleagues, we were supposed to break at 2:30 and have a 1 hour break before we come back at 1:30 for the second batch of hearings. We're talking about pushing back till 1:45. I have one more folder here. Senator Washington, are you okay with pushing back and doing that after lunch and doing that at 1:45? You're muted, but I think you said absolutely. I read your, yes. Okay. All right. Colleagues, we will adjourn this hearing and reconvene at 1:45 for being here. We'll see you in a little while. Bye.
We will start momentarily. We're just waiting one more member. Okay, having attained a quorum, welcome to the Education, Health, and Environmental Affairs afternoon session, also known as the Washington Hour. Our first three bills will be from Senator from Baltimore, Senator Washington. Not to reiterate too much, we start with the sponsor, followed by the proponents, then take questions, then go to the opponents and take questions there as well. I will try to announce if there's no opposition, in which case you can even be more concise or cogent than you plan to be. With that, we're going to start with Senate Bill 438, Public Schools, Pregnant and Parenting Students, Policies and Reports. We'll start with the sponsor. She'll be followed by Diana Phillips, Isabel Wise, Maggie McCaughey, and then Molly Sheehan. Then we'll take questions, and then we'll move to John Willems and Laura Bogley. Senator Washington, please. You need
You're
to
muted, Senator. Well, I just said everything. Hello, everyone. Good afternoon.
Say it again.
Yes, these are 3 bills. And so what I thought we see them as a package. And so I'm just going to give introductory remarks at the package. So we'll save time. I'm not going to introduce each bill. I mean, I'm going to describe them all together, and then the panels will follow so that we can address it. These is a package of bills, and we certainly are going to consider them separately, but just conceptually they're thought of as working together or building on each other. And it's actually not unlike the approach that I took about 7 years ago with my colleague, then Senator, and I was a delegate, Riley, when we were looking at the issue of homeless youth, where we sort of started out with gathering information, starting out and combining sort of a project to sort of a small scale project to look at it in a few jurisdictions with highest rates, and then set forth some planning on it. So this is sort of conceptually what we're building here, and understanding that all of this is going to take time, but it's addressing the issue of the ways in which we can improve the ability and the rate of pregnant, expected, and parenting students to complete their education in Maryland schools. So by way of just some background, Title IX, federal civil law, prohibits discrimination on the basis of sex, right? And so that also includes pregnant, expectant, and parenting students. Title IX ensures that these students are protected by allowing them to continue participation in classes. They have the right to do extracurricular activities. We need to provide reasonable accommodations to them in the learning environment. And then recently, again, the way in which I was specifically introduced to this topic, I had the honor of doing the floor defense when I was in Ways and Means Committee on ensuring that excused absences due to pregnancy or childbirth, where students were allowed to take time. So we have made some minor steps in this area, but that was about 5 years ago. And so I think we need a more sort of targeted approach. Some schools seek to support students, and that's true, they're doing a great job. Some school systems, so this is not an indictment of all school systems, but simply that we still need to do so much more across the state so that we can create a school climate that's not, frankly, toxic for some of our students. So they choose to either drop out of school during pregnancy, or they decide to not return after giving birth. In other instances, students have been blocked from enrolling in school. They've been targeted to do online. Now, of course, in COVID, we're all doing, but this is prior to that. They're being encouraged to do GEDs and been banned from returning once actually someone believes a student has been pregnant and is choosing to have their child. Too often, pregnant and parenting students feel pushed out of school. And also sometimes that happens because there's a lack of educational accommodations, but also frankly, at times bullying and harassment that they face from their peers and even sometimes school staff. The last 5 years, our own state, Maryland vital statistics said that there's from 2,500 to 3,000 babies born to school-aged teens each year. And we can assume that many of these youth are enrolled in schools during their pregnancies or their partners' pregnancies. We also expanded some rights for partners to be able to participate in that. But we do not really know, we don't have data, we don't know how many of these students have gone on to obtain their high school diplomas. What's also very heartwarming and from a policy perspective, both challenging, but I think it provides a great opportunity, is that there's a broad coalition of people who are generally supportive of these 3 bills. And I know that there's some opposition or some amendments, more of like, some concerns about how we go about it, but I think we all agree on the goal that we want to make sure that pregnant and parenting teens, our parents are able to complete their education. We have the national NARAL as well. So we have the Maryland Coalition for Reform School Discipline. We have NARAL Pro-Choice, Maryland Catholic Conference, the Women's Law Center, some pediatrics. So we have a wide range of individuals that are coming together to say, now is the time for us to do something for our pregnant, expecting, and parenting teens, also known as PEP, right? So the first bill is SB 438. It's really straightforward. It's calling for us to help students be engaged in a consistent attendance and participation by helping those who've decided to parent, helping them with support for them to stay in school and to graduate on track. We know something about these youth. We need to know more, but one of the things is we know nationally that 40% of teen mothers finish high school, that only 40%. And we also know about a third of males who are parents drop out because, and again, to their credit in some ways, they drop out that they want to be a parent. So SB 438 builds on the legislation that Maryland passed in 2017, establishing excused absences for legal and medical reasons, and recognizing that pregnancy is not an illness and that youth need not be labeled as truant and if they need to take care of their child care. SB 438 calls for policies to be developed by each school district to support parenting students and for school staff that assist them. So we want to develop the policies. We want these policies to connect students to childcare. We want to have plans and policies to connect transportation resources. We want to be able to identify appropriate spaces for lactation. And we have to figure out spaces in which school staff and faculty will also have these facilities. The bill calls for excused time away for class to pump, as youth really should have meaningful ways to support and feed their babies. So we hope that these discussions and generated between students and their schools will occur in advance of when the resources are needed, so that there's little or no interruption in school attendance and class or participation. So that's the part about the expectant. So when young people are expectant, we need to have these conversations, have them connected to school resources, have there be a plan for how we address this. We also need to make sure that there's a school handbook and that everybody knows the rules. We know nationally childcare is important. I don't have to make that argument, but you should know that the lack of childcare is the #1 reason that new parenting students don't return to school. So some advocates that are going to speak in support of the bill are going to speak specifically to that. With COVID-19 and the pandemic, the mandate of school remote learning, some student parents are really having a difficult time because they're parenting, there's no childcare, and they're also trying to go to school. We did some preliminary research, and I look forward to the school districts reporting out on this as well, but we just did a scan with some interns of the 24 school districts between August and October and found that there were few plans, very consistent plans for childcare or some kind of child assistance. And so we think that MDE, the comptroller, the governor's office, we really haven't found any real, by surveying those agencies, we haven't found sort of, at least on the website or from the phone calls, state assistance for childcare or some way that we're addressing that. What this bill doesn't do, it doesn't require hiring. It's not legislating the school staff or public funding at this point. It's not trying to influence any pregnancy decisions. The real key to these 3 bills is that the decision has already been made by the parent to parent. So we're not getting into the reproductive choice or adoption. It's that they've already decided to do this. The bill calls for the schools to stop discriminating, and that also students have a right to attend. Now, the other thing is that we need, so now getting into the other 2 bills, is that now we need some data to help us learn more about dropout and the push out experience of these students. And that's where SB 470 and SB 437 come in. Maryland's not really collecting data on educational outcomes for pregnant, expectant, and parenting students. But we are aware that there are thousands of students whose whereabouts are sort of unknown each academic year. And many of those students have had babies. And a small number of the exit interviews that have been done, students are indicating that pregnancy was a factor in them leaving. So they're kind of missing out there. The work SB 47 is looking to build out a project with the University of Maryland School of Social Work and Institution for Implementation Innovation. They were our partners, our policy and research and academic partners on the homeless youth projects, which is what we call REACH Maryland, where we designed a questionnaire, worked with affected communities and partners across the state of Maryland, starting out with 6 targeted areas. And we now have this really robust database for how to really develop policy. It's our hope that we could do through a 3-year project, a similar type of project, working with the School of Social Work, specifically for pregnant, expecting, and parenting teams. And so the third bill, again, is actually a suggestion of my former chair, Delegate Ann Kaiser, where she's looking at something that we already have, which is a Maryland longitudinal database. And we want to make some connections and to find out how we can use that database to specifically note pregnant and parenting status of students in order for us to track their educational outcomes over time. That data is going to be collected by school administrators. It will remain anonymous in the database. We can assure privacy of the youth, but accurate data collection. And again, there's this expert guidance from the University of Maryland. So school systems don't have to engage in the actual data collection. We can work with the partners as well. So just the panels for SB 438. And so I know you want to do the panels one at a time, Chairman, so I'll just stop after I introduce that. And I look forward for us working together on addressing the issues and really increasing the rates of graduation and the in-school experiences of pregnant, expectant, and parenting young adults. So this is panels SB 438.
Okay, we're going to start with Diana Phillip from NARAL. She'll be followed by Isabella Wise, and then Maggie McCahey, and then Molly Sheehan, in that order. Ms. Phillip.
Thank you, Chair Pinsky, Vice Chair Kagan, members of the Education, Health, and Environmental Affairs Committee. My name is Diana Phillip. I'm the Executive Director for NARAL Pro-Choice Maryland, urging a favorable report on SB 438. Thank you, Senator Washington, for your leadership. I'm also representing today the Coalition Protect Maryland's Children and the Coalition to Reform School Discipline. In fact, there's 40 different kinds of organizations from ACLU of Maryland to the Associated Catholic Charities that are supporting this bill. Why this bill? You want to ask, well, where did this come from? Well, Reproductive Freedom calls for supporting the rights to parent. And several years ago, when I was the policy director for Free State Justice, working on a model school policy to support LGBTQ youth and working on another bill to establish an ombudsman for foster care youth, I was meeting with young people in focus groups and community centers to find out more about why Maryland youth were experiencing homelessness or housing instability. Along with being rejected by their families and their foster care placements, I was not surprised to hear about the number of youth having been discriminated and harassed at school and either dropped out or was pushed out. However, I was surprised by the number of parenting youth that shared the same experiences, either being thrown out of their homes or rejected by the schools for becoming pregnant. When I came to my current position at Maryland NARAL, we began looking at the school push-out factors because advocating for bearing healthy children and preventing pregnancy discrimination are among what we do. In 2017, we were the lead advocates for the legislation establishing excused absences for pregnant, expectant, and parenting students for medical and legal reasons. Maryland was the second in the nation to pass this law, and Nebraska was third. But Nebraska included requirements for liaisons in each school to coordinate childcare, transportation, lactation spaces. This made sense to us as many allies I interviewed across our state raised concerns about how our parenting could really use the same resources. For example, a pupil personnel worker in Prince George's County stated that the number one reason why her parenting students don't come back to school was lack of childcare. A Baltimore City Health Department social worker told me about a high school couple that when confronted by school staff about exceeding the number of school days they missed in one semester, the students revealed that they just had a baby and were taking turns staying at home to care for their child because they had no one to help them. Remember, in our state, infants 6 weeks or younger are now allowed in regulated childcare centers. The lack of childcare options has worsened, as we all know, during the pandemic, not for only working parents, but also parenting students. And many of these students were not only taking care of their own children, but also other kids in the same household during the lockdown. Access to childcare subsidies is another problem. Talking with MSDE and the Maryland Family Network, there are concerns that the application process can be too cumbersome and many students are rejected, with the appeal process taking 4 to 6 weeks. In our focus groups, the Baltimore City Patterson High School students were parenting. Not only did they report not being able to come to school on days without childcare, but inconsistent transportation to and from school, or needing to drop off their children for daycare, which was also a barrier to school attendance. And I first came across the lack of support in schools regarding lactation through a conversation with Maryland State Education Association's Sean Johnson, who told me about his visit in an elementary school in Montgomery County, where 4 teachers who were new parents confronted him about having no designated space to pump. Breastfeeding is important to feed babies and encourage bonding that will help prevent child abuse and neglect. In 2019, Senator Ellis was the lead sponsor on a bill to create a task force to assess the scope of these problems, but Speaker Bush wanted no task force bills that year. Last year, Senator Lamb was the lead on a bill that included many of the provisions in this year's bill, including the data collection and reporting, but we ran out of time last session due to the pandemic. This year, Senator Washington is presenting these 3 bills for your consideration. Senate Bill 438 has no fiscal note. Again, no one is asking to hire extra staff or build childcare centers or lactation pods. Students want to know which school staff can help them connect to existing community resources and existing on-site accommodations in order to stay in school and on track to graduate. We know that the value of a high school diploma and how key that is to their economic security. And they have already made that decision to parent. In the spirit of reproductive freedom and educational equity, Maryland needs to do more to support parenting students in our secondary schools, and this means high school and middle schools. Remember that 30 to 50% of girls begin menstruation by the age of 12 while they're in elementary school, meaning our middle schools need to be just as prepared as our high schools. Isabella Wise, which unfortunately is not going to be able to follow me today because she didn't understand the system to upload everything, is her written testimony, which we'll share with you. She talks about becoming pregnant in 8th grade and how she was pushed out of school, eventually getting her GED at 21, and how this bill is important in the work she does with youth now. As she states, all she needed was one person in school to believe in her. The nonprofit Identity Incorporated in Gaithersburg did a great research study in which 1,000 Latino youth were represented cohorts that either were currently enrolled in high school, had graduated, or dropped out, were asked about factors that influenced their school participation. The most important factor was the expectations expressed by the adults in their lives that they would graduate. Coordinating with students
Ms. Phillip,
to help.
you're gonna have to wrap up, Ms. Phillip.
Of course. This coordination with students is something the schools should be doing. And for over 2,000 of these students across the 282 public high schools, it should only be a handful of students who are assisted each semester. We urge favorable support on Senate Bill 438. Thank you.
Thank you, Ms. Phillip. If Ms. Wise is not here, let's go to Maggie McCahey. Are you with us, Ms. McCahey?
Yes, thank you.
Please begin.
So I am a social worker with over 3 years of experience working with adolescents in the Maryland public school system, and I strongly support Senate Bill 438, Pregnant and Parenting Student Policies. These policies will ensure that parenting students receive supports to achieve their educational outcomes. The state's average teen pregnancy rate is 14.1 per 1,000 females, and that's age 15 to 19. And this number increases 5-fold when the scope is narrowed to the population of teenagers that I work with in South Baltimore. So in this particular region of Maryland, the teen pregnancy rate is over 70 per 1,000 females. And unfortunately, the national teen parent graduation rate and the 5-year graduation rate in Baltimore City public schools are both only around 40%. So our public school system in Maryland makes dropping out of school an easy decision for over half of our pregnant and parenting students. Children are expensive, so teenage parents first have the difficulty and pricey decision of figuring out childcare. So if the teen can find affordable quality childcare, young moms and dads are then faced with either to continue with school themselves or find a job to earn money so that they can provide their kids with childcare. So most of the 50 plus parenting students I've encountered attempt to do both, work and attend school and find their kid childcare, but less than half are able to sustain that lifestyle and end up dropping out of school. So getting to school alone can take a parenting student over twice the time as an average student because they have to use public transportation to get their child to daycare and then make their own journey to school. The public school system can also make childcare responsibilities impossible for teen parents. So medical research tells us that breastfeeding has major health benefits for infants and their mothers. However, in my 3 years of work with parenting teenagers, I've yet to meet a teen parent who chose to breastfeed after returning to school because there's simply no space for them to safely pump and store breast milk in the school. So providing the lactation spaces will allow students to prioritize both their education and their child's health. So currently I'm working with an expectant student who's due in the end of the month, the student was just told that she will be expected to continue to complete schoolwork online since Baltimore City schools are still virtual. So all parents deserve excused time off to recover, bond with their baby, and get acclimated to being a parent, no matter if they are a state employee or a high school student. However, I know that for many students, pregnancy leads to an overwhelming number of excused absences that make continuing a school with uphill battle. This bill would ensure that every parenting student has an advocate in their school that will ensure the attendance and unexcused absence policy is upheld.
You've got to wrap up.
Sure, I strongly encourage you to support Senate Bill 438 to allow pregnant and parenting students the support they deserve.
Thank you, Ms. McCaughey. Let's go to Molly Sheehan.
Thank you. Thank you to the Honorable Chair, Vice Chair, members of the Education, Health, and Environmental Affairs Committee. My name is Molly Sheehan, Associate Director for the Maryland Catholic Conference, in support of Senate Bill 438, and I thank Senator Washington for bringing it. This bill would bring Maryland up to date with the Title IX rights of pregnant and parenting students to ensure student mothers especially are supported. I've personally heard from pregnant and parenting students who had to sit in desk chairs that were too small for their pregnant bellies or were not given bathroom passes. Girls have told me that they had to pump in a bathroom stall. They may not have knowledge of WIC or SNAP or diaper banks or where they can get prenatal care or childcare, and they may even be bullied or harassed for their baby bump. This bill would help student parents, providing a private lactation room, complete with a fridge, outlet for a breast pump, and chair. It would give them knowledge of resources and a model policy to support the educational and career goals of student parents. One study found 30% of teen mothers say pregnancy or parenthood was the reason they dropped out of school, and this disproportionately affects students of color. Too often, a student mother is forced to choose between her child and her dreams for educational attainment. If she drops out of school, that affects her lifetime earnings and the well-being of her child too. The conference supports SB 438 because we believe each young mother should be supported to achieve her educational dreams. This bill would bring equity to student parents so they can meet their unique challenges with courage. And we would like to be a meaningful partner with MSDE in implementing the model policy to match what is used around the country. And for these reasons, the Maryland Catholic Conference respectfully urges a favorable report for SB 438. Thank you for your time.
Thank you, Ms. Sheehan. Let's take questions for any of the proponents, then we'll move to the opponents. I believe we have two. Committee questions. Seeing none, it was pretty straightforward and pretty cogent. Let's then go to John Woolens, followed by Laura Bogley.
Mr. Chair, members of the committee, John Woolens representing the Maryland Association of Boards of Education. The committee has my written testimony, which I want to emphasize is somewhat in the opposition with amendments category, which I know is not one of the official categories, and in that we heard the House hearing and wanted to be as constructive as possible in our input on this legislation. Our testimony does not focus on the policy mandate per se, in that we are 100% in favor of Title IX compliance with regard to pregnant and parenting policies. And while this legislation goes a bit beyond that, we are certainly wanting to be on record as fully supporting that. With regard to the space, I've already heard testimony today from Ms. Phillip and I believe the bill sponsor with regard to the lactation space requirements, and Mabe's testimony provides some clarification around the ADA requirements for a separate space and privacy, all of which is hugely important. And again, so trying to be helpful in that regard. And then with regard to the definition of parenting student, it does seem quite broad with regard to any student responsible for the care or custody of a student. But that said, I've also heard testimony today that clarifies that it is not the intent, at least now, to require staffing specifically attached to either serving as a liaison to connect students with these services, which of course is hugely important. And I do think this is an issue that we're going to be talking a lot more about with regard to wraparound services and what is the school system's role with regard to connecting students with services as that relates or contrasts with providing those services. But I know that Senator Washington certainly appreciates those issues, and the committee does as well. So the committee has made written testimony, and we do look forward to making continuous improvement to serve our pregnant and parenting students beyond just treating their absences as lawful absences, but to also ensure that we're doing what we can to not only comply with the federal law, but to go extra steps to ensure that they are completing their educations. Thank you.
Thank you, Mr. Woolham. And Ms. Bogley.
Yes, good afternoon, Chairman Pinsky and esteemed members of the committee. Thank you so much for your time to talk with you today. My name is Laura Bogley, and I serve as Legislative Director for Maryland Right to Life. On behalf of our members across the state, we respectfully oppose Senate Bill 438, which will impact both pregnant and parenting students. We agree the state can better support pregnant students in both positive birth and educational outcomes. But in implementation, this bill will be used to expand the promotion of abortion to school-age children without their parents' knowledge or consent. This bill is part of ongoing incremental legislation, as we heard today, supported by the National Abortion Rights Action League to codify federal Title IX protections for pregnant students. And while the bill language makes no mention of abortion, Title IX includes the termination of pregnancy. The state of Maryland has shown a strong preference for public investment in abortion rather than prenatal care and adoption programs. And as a result, the state has failed to reduce the number of abortions. Planned Parenthood in their 2020 annual report self-reports that the number of abortions they committed increased nearly 3% from the previous year for a record high total of 354,871 children aborted. In stark contrast, they report that their prenatal care and adoption referrals both dropped double digits from the previous year. If the state of Maryland is serious about reducing abortions and helping pregnant students, we should stop trusting those who stand to profit from abortion with the education and care of our youth. Pregnant students do not need to choose between their education and the life of their children. What they need are health and community services that empower them to choose life for their children, including programs for improving maternal health and birth and delivery outcomes, well baby care, parenting classes, foster care reform, and affordable adoption options. And data collection is not the solution when the abortion industry controls the data. For these reasons, we urge you to address real solutions for pregnant students, which we could support, and we ask you to issue an unfavorable report on this bill. Thank you again for your time.
Thank you, Ms. Bogley. Let me start off. I have a question for each of you. Mr. Williams, I haven't had a chance to read your testimony. Is your opposition, although you have some suggestions for improving it, based on local school boards don't want to be told what to do, or the implementation, particularly the space concerns? I'm just trying to get a handle on if it's a systemic disagreement or the actual implementation as described in the bill. Just give us some direction on this.
Mr. Chairman, thank you. Yes, it is not pointed opposition to state developing model policy in this area, and certainly we're familiar with the dynamics of the state developing model policy, there being a stakeholder process and our following through with local policies. While we would generally kind of on principle oppose being mandated to adopt a policy on anything, we make a lot of exceptions to that. And certainly student health is one of those areas where we do value the role of working with the state on model policy and other advocates. But in terms of the scope of the legislation, it does, we feel, very broadly define a parenting student as any student who exercises care, custody, or control of a child. And then while not technically requiring us to provide services for those students, it does set us on a course of being required to facilitate or connect students with services such as childcare and transportation, which goes far beyond what we're currently required to do. And similarly, the lactation space requirements, we feel in terms of essentially for staff, you can use a separate space that provides privacy, and we feel that should be sufficient with regard to students as well.
Just one quick rejoinder. As with Kerwin, we're trying to expand wraparound services, looking at the whole child. offer direction or other support services, is it because you find it onerous or you don't think the school system should be involved in that?
We should definitely be involved, to be clear, and we would never want to say that we should not be involved. And this legislation doesn't take the next steps, and I think the sponsor and others have been clear, even if they say yet or not, as perhaps it's done more extensively in other states or other circumstances. We appreciate that.
Okay, and Ms. Bogley, other than the reproductive rights organization supporting this legislation, you know, I read the legislation and I'm trying to understand which of the policies you disagree with. I mean, you talk about Title IX. I don't even see Title IX mentioned in the bill. So if we can separate who we're advocating for this from the policy itself, what section or what lines do you have disagreement with?
Well, thank you for the question, Chairman Pinsky. I wish that we could separate the policy from stakeholders, but we know in application that's not the reality we're dealing with. So we would like, is that we ideally would like a law passed in the state to require reproductive health education programs to be unbiased. That has not been the case, and I think that's demonstrated by the abortion increased numbers.
But Ms. Bogley,
yes.
Reproductive education in this bill, it's actually when someone is a parent, when they've chosen to carry a child and giving support services. So again, I guess I'm just sort of thrown by your opposition.
Senator, I'm not aware if there was an amendment that excluded the language for pregnant students or establishing policies related to pregnant students. Has there been an amendment?
Well, no, I mean, it says require schools to assist and advise pregnant and parenting students with finding safe, affordable, and reliable childcare, transportation, and support services. It's not about, I mean, no, I don't want to try to define the bill. I mean, that we have a sponsor here. I'm just thinking you're reading something into this bill that's not there. And if offline, you can point out the sections that you find distasteful or disagree with, I'd appreciate it. Thank you. Senator Ellis.
Yeah, thank you, Mr. Chairman, Chairman Pinsky, and Senator Washington for this bill. And listening to the testimony, and I hear words like lactation stations, and that means if you have a student who will go in a lactation station, that means they had the baby and they want to take care of the baby. And so I'm not sure, following the line of the question of Mr. Chairman, is where does abortion comes into that? Because obviously they've had the baby. That's a question. Another question I have, I just ask them really quick, is that folks have come to me and say, hey, I really don't like this legislation because it'll encourage young people to have babies, and so no one said it'll encourage them to have abortion. Because a lot of young folks, they see nice things for their colleagues, and they're like, oh, they want it too, right? So encourage them to keep their babies. So that's the feedback I'm getting. I'm not sure how, Ms. Bogley, you hear a lactation station and you think about abortion. Could you explain that to me?
Well, thank you for the question, Senator Ellis. What we're concerned about is the broad policy mandate for pregnant students. And we know from current practice from the state of Maryland that there's no pro-science, pro-life voice represented in those stakeholders. So what we're seeing as the result is we're having under referral for adoption options. And as we saw from Planned Parenthood's actual report, that they are way down on their prenatal services. So what we would like to see is a balance, and there's a connection, of course, between reproductive health education and programs. Policy, education, and programs all go hand in hand. And so until we can assure that there's an affirmative pro-life message being given to these students, that they do not have to choose between the life of their child and being successful or continuing their education, then we're doing the students a disservice.
Yeah. Right, I understand. Thank you.
Yeah. Thank you. If I may, Chairman, I'd like to just address this in broad. So the reality is that we have students in the state of Maryland who, because they choose to raise their children, are experiencing either being dissuaded from continuing their education and don't have the supports. So we are looking at childcare, as you said, transportation, excused absences. I think we're giving a platform to something that, again, as you all see, is not in the bill. And in fact,
Senator, I think we've acknowledged that. I think
thank you. Thank you.
We've read the bill.
Yep.
Okay,
I just wanted to do it for the public. Thank you so much.
understood. Thank you. That concludes the hearing on the first Washington bill. Now we're going to move to 470, the data collection bill on the same subject of pregnant, expecting, and parenting solutions. We'll start with the good senator, followed by Brittany Ellers and Margot Candelaria. The only unfavorable is written and not oral. Senator Washington.
And thank you. I've already outlined these in my remarks. So I'm happy to go directly to my panel, Mr. Chairman.
And
that would be Ross
very kind of you. Let's start with Ms. Ellers, please.
All right, thank you. Good afternoon, Honorable Chair, Madam Vice Chair, and members of this committee. Thank you so much for allowing me the opportunity to speak today. My name is Brittany Ehlers, and I'm a policy and research intern with NARAL Pro-Choice Maryland and a Master of Public Health candidate at Johns Hopkins Bloomberg School of Public Health. I'm here to express my strong support for Senate Bill 470, and I'm also here speaking on behalf of the Coalition to Reform School Discipline and the Coalition to Protect Maryland's Children. And as previously mentioned, this bill will establish a partnership between the University of Maryland School of Social Work's Institute for Innovation and 5 high-priority school districts to collect and disseminate data for pregnant and parenting youth and provide them with essential resources for achieving their educational outcomes while balancing their parenting-related responsibilities. Nationwide, approximately 1/2 of female dropouts and 1/3 of male dropouts say that becoming a parent was a factor in their decision to leave school. Maryland's public high schools reported the lowest graduation rate in recent years in 2018, attributing to thousands of students dropping out of high school. However, that year, over 2,600 babies were born to teenagers in the state. Maryland's public high schools, however, reported that only 49 students formally withdrew during that academic year for pregnancy or parenting reasons, while approximately 5,000 were categorized as whereabouts unknown, indicating that the students were never asked why they left and school districts did not follow up on reporting. We fear that this represents a large percentage of pregnant, expectant, and parenting youth who are dropping out and unreported by school districts, and if not appropriately addressed, this number will continue to grow. Senate Bill 470 emphasizes one of the most important aspects of ensuring the success of policies, which is monitoring, reporting, and evaluation. We've already supported a bill regarding policy updates that specifically strengthen resources for these pregnant, expectant, and parenting youth here in schools. But now I'm expressing my support for this partnership so that school districts can accurately assess the true number of pregnant and parenting youth that are being pushed out of schools because they are not receiving enough support to balance their family and educational goals. We call for the state to invest in meaningful data collection and reporting to inform future statewide policy efforts. This partnership will directly close these gaps in reporting and data dissemination and ensure that reproductive equity and justice is being achieved for Maryland's pregnant and parenting youth. And for these reasons, we urge a favorable report on Senate Bill 470. Thank you.
Thank you, Ms. Ehlers. Ms. Candelaria.
Hello, thank you, Honorable Chair, Vice Chair, and Senator Washington. My name is Margot Candelaria. I'm a research assistant professor at the University of Maryland School of Social Work at the Institute for Innovation and Implementation, and I'm the co-chair, the co-director of our Parent, Infant, Early Childhood Unit. I'm here today to speak favorably on this bill, which would provide support to select school districts to learn better strategies for identifying and documenting students who are pregnant and parenting, to be sure that that status is understood and therefore they are connected with supportive services. In order for parents to succeed as students, parents, and members of society, they really need to, we need the adults around them to understand what their status is and know to connect them. This directly relates to the previous bill. Brittany just said, the idea that only 49 students were formally documented as withdrawn due to a pregnancy or parenting status indicates to me that there is a significant discrepancy between how we document what's happening with our students and what is actually happening with our students. And the reason that that's important is we can't make informed decisions about services or funding or what schools need or what students need to be successful without really understanding what the data is telling us, right? So we actually need jurisdictions to be accurate in saying this is how many students that are pregnant and parenting, and therefore we might need different staffing, different funding, different mechanisms, but we can't answer those questions unless we know what the reality is. So the most important thing to me is that we really understand what's happening. I had the fortune of working for the last few years in Baltimore City as the main evaluator for their Map to Success project, which was an HHS-funded pregnancy assistance grant. And what we did was go into schools and community centers, places of higher ed, libraries, things like that, where students were identified that they were pregnant or parenting, identified what services they need, and connected them with parenting programs, childcare, WIC, SNAP, diapers, clothing, housing assistance, healthcare, all of the things, with the idea of not stigmatizing them, but supporting them to set goals for the future. We had very good outcomes in our study in Baltimore, but nationally, the Pregnancy Assistance Fund has demonstrated that when you offer services, these students are more likely to graduate high school, more likely to have plans to enter college, and more likely to be working in the future. So we really just want to support Maryland students with this bill. I would like to just preemptively, in speaking to the next bill that we're going to discuss, say this is a 3-year project to improve the data collection system, and then we will be done and it will feed into the MLDS system that we're going to discuss next. The reason it's important to do this first and not just, start with MLDS only is because, again, we already know that the data is inaccurate. So we want to make sure we feed into a system accurate data, and then after that, we won't need to fund this part of the project anymore. I'll save the time for other comments and questions, but obviously I'm very much in favor.
Okay, questions for the sponsor or the two panelists? I have one, and I might have missed it, Ms. Candelaria. I think you list 5 counties.
Yeah.
If it's really to track how they do graduation, GED, and all this other things, whether those counties have a higher proportion of pregnancies or not, why are you limiting to those 5? Yeah.
So we originally, when we talked about this bill last year, we really were hoping to try to get most jurisdictions, but the cost of doing that was prohibitive. And so in order to manage costs, we're treating it like a pilot project. We selected the 5 counties, like the 5 regions of the state, within each region, the county that had the highest teen pregnancy rate.
Okay, and related but separate question, is this a contract with the School of Social Work, or is this pro bono, or what?
The fiscal note would devote a portion of the funding to help the School of Social Work, just in terms of funding, data collection, analysis, and reporting back to the state.
So yeah, so Chairman, this is modeling off of what we've done successfully with ending youth homelessness. We were able to get, and I'm hopeful that we were able to work closely and with the governor to continue to support it. We were successful. This governor continued a $200,000 appropriation. Each. I think it's each sort of 4, I guess it was like 5 years to handle the work that the School of Social Work did. And we're hopeful that that type of partnership will happen. Additionally, the School of Social Work is applying for grants. And so saying that it has a partner in this has helped with that. So again, we're hoping, Senator, that we can continue a successful model, that we get partnership from our governor. He has shown support of this type of work in the past, and I'm just hopeful that will continue in the future.
Great. Not seeing any other questions. That completes the hearing on Bill 7470, Senator Washington. The third one is the longitudinal data system, which comes under purview, which collects data statewide on multiple elements, but mostly primarily on youth, adolescents, and young adults. We'll have Senator Washington very briefly, and then she'll go to her panel, which is essentially Ms. Ehlers or Ellers from NARAL. The rest is written. And
For the
for
the record, Senator Mary Washington, but we'll just go right to the panel because we've
okay. The panel is panel of one.
Yes.
And no either oral or written testimony in opposition. Ms. Ellers.
All right, thank you once again. Good afternoon, everyone. I'll just talk very briefly about what this bill does. It's very straightforward. Basically, there is the Maryland Longitudinal State Database System that already tracks educational outcomes for students in the state. This will just go ahead and put in a pregnant and parenting status indicator, indicating whether or not the student is a parent or is expecting a child. And what we want to see from this is their graduation rates and if they're actually able to graduate on time with their cohort. As mentioned, this data will be collected by school administration and remain anonymous in the database system, which will ensure the privacy of these youth and accurate data collection methods. I also just briefly wanted to note that Maryland is not the first state to do this. The Wisconsin Department of Education had utilized an indicator for pregnant and parenting youth in their state to track education and health outcomes for teenage mothers. And again, the data was kept anonymous and information was kept via self-reporting from students. And this allowed them to see, track repeat pregnancies as well as graduation rates for that group of students. So we are urging a favorable report on this, and we believe that Maryland youth, regardless of pregnancy or parenting status, should have the full accessibility to existing resources, and the state needs to better track information on this group of students. Thank you.
Thank you. Questions? Seeing none, that completes the hearing on the third Washington bill. Very efficient and concise. Thank you, Madam Senator, and all of the witnesses.
Thank you. Thank you.
Thank you all, and for your patience. We're going to go to Senator Reedy, 439. Are you with us, Senator? Senator.
Yes, Mr. Chairman, hello.
Okay, thank you. This is Senate Bill 439, Public Institution of Higher Education, Student Athletes, Jordan McNair Safe and Fair Play Act. We will hear from Senator Reedy. He'll be followed by Jordan McNair, Brian Hess, Benjamin Bateman, and Dan Alpert. Then we'll take questions if you can stay, Senator. Then we'll move to the unfavorable individual testifying, Mr. Page. So with that, Senator, welcome to EHE.
Thank you very much, Mr. Chairman and members of the committee. And I was kind of listening to my committee and having yours on at the same time. So I thank you for your indulgence. I'm really excited to be here today to present Senate Bill 439. It is, I think, an important and I hope interesting piece of legislation. We brought this idea to you last year. A delegate, Brooke Learman, and I working on this in a very bipartisan fashion in both houses, really trying to fuse. There's two major concepts in the bill, but the overall goal is to improve the well-being of our student athletes in Maryland, health-wise, both mental, physical health, academic health, and also their economic well-being. Really trying to look at all of that. So I'm going to just go ahead and present the bill. Before I start, also, I know we weren't able to really get into it last year because we presented it and then the whole world fell apart. So we've been working on it all interim with the stakeholders, the number of stakeholders. There are some significant amendments that the House made, and so I'm going to present my testimony on the bill. But I'll also circle back to talk about what some of the amendments, do. So Senate Bill 439 follows the lead of 5 other states that have laws on the books and many other states with similar proposals to ensure that our intercollegiate student athletes at public universities are not prohibited from using their name, image, or likeness to earn income. We also, in the bill, are laying out some ground rules and some key metrics for protecting student athletes' health and wellness as well. With as drafted, the bill, it was a bill of rights, and there's been some amendments to that to refine the scope, but that's the still overarching concept. And we're proud to have the support of a number of stakeholders, including Mr. McNair, who we're so appreciative to have his support. Right now on every campus in America, any college student who's not an NCAA athlete has the right to earn money in any legal way that they want, whether it's inventing a YouTube channel that they can make money off of talking about something, or selling artwork, performing. If they're a student that's learning, that's a musician that's on scholarship, they can go teach lessons in the summertime. There's a lot of examples we could use. But that is not the case for NCAA athletes. So this bill will ensure that all students have this right. It also requires, as I said, schools to adopt, and now more importantly, the amendments focused on adopting health and safety guidelines to prevent and treat injury and ensure that there's access to proper academic support as well, but also reporting so that we know. Now, traditionally, all of state legislatures around the country have always outsourced the treatment of their state's college athletes really to the NCAA in large part. And this reliance has become very outdated over the years. The NCAA itself asserts that it has no duty to protect student athletes from injury or guarantee an athlete medical coverage for sports-related injury, or ensure that they're not being pushed into academic programs to make it easier for them to play their sport, or academic integrity beyond the NCAA will enforce if they find out about a cheating scandal to keep an athlete eligible. That's about the extent of it. And even that is oftentimes years later that they get involved. And so states have started to take matters into their own hands, as I alluded to earlier, particularly on name, image, and likeness legislation. So we want, Delegate Limerick and I believe and our co-sponsors believe it's time for our assembly to take action on critical issues that in many cases were previously sort of left up to the NCAA. The legislation ensures that student athletes are treated fairly, their health and safety are prioritized, but also this legislation, it would ensure that student athletes are not excluded from the right to earn income from their name, image, and likeness. Athletic coaches and athletic administrators earn millions of dollars a year. Many are the highest paid state employees in their relative states. Not all of that coming from taxpayer dollars, but still they're often one of or the highest paid state employee. And while the athletes themselves are basically denied the ability to earn any outside income related to their sport. And so these are unnecessary and anti-competitive restrictions. And what it does is it has the effect of exacerbating student athletes' financial challenges. And it's really unfair to the male athletes and female athletes. The vast majority of both male and female student athletes have no professional future in their sport. But they have an opportunity because of the work they put in and what they're doing to be marketable for a brief period of time. Particularly, we often think of name, image, and likeness is often thought of as athletes getting endorsements. And that certainly would happen with this, but it's also the opportunity for a female lacrosse player to go back home and run a camp for a couple of months, for 3 or 4 weeks in their home county, and be able to make money from running a camp based on the fact that they're a well-known scholarship lacrosse player. Or you can use that. The examples kind of can flow forward from that, but that's those kind of examples that right now are just not possible. Many student athletes also, we can't ignore the fact that they come from low-income households. Over 80% of college athletes are living below the federal poverty level. And oftentimes we have student athletes who are the first in their family to attend college. And scholarships are fantastic, and that's a big part. It's a wonderful thing, but they're not the same as income. And there's many at sports where an athlete is getting maybe a partial scholarship as well. So again, the opportunity to go out and earn income based on their name, image, and likeness is a powerful tool for economic empowerment, particularly for these athletes that are well below the poverty line. So the NCAA has looked at this issue before. For many years, this has been in front of the NCAA. and they've promised they're going to address the issue, but they keep dragging their feet. And even just as recently as a couple of months ago, they planned at their major conference with all their athletic directors and administrators and from all the levels of the NCAA, Division I down to Division III, that they were going to tackle this issue once and for all, and they punted once again. They keep waiting for Washington to act. And there is bipartisan legislation in Washington dealing with name, image, and likeness. But we all know on this committee, no matter what side of the partisan divide you are, waiting for Washington to take action is not necessarily a great strategy in many cases. So we want to have Maryland be on the forefront. We want to allow student athletes to be able to earn income from their name, image, and likeness, but also make sure that we are protecting their health and safety. I truly believe that this bill can make a major difference in the lives of our student athletes, not just at the University of Maryland, which is what you commonly would think of with this bill, but all throughout the system. Very briefly, Mr. Chairman, because I know I have some witnesses and I want to be sure they get a chance to share their thoughts. I believe the committee has the amendment from the House, and if you just looked at the amendment without the reprint, it could be a little confusing. I just want to specify that what the amendments in the House did were a result of work with the University of Maryland system, University of Maryland College Park, and a number of other stakeholders to be sure we refined the scope. A lot of the amendments deal with what we had as the Bill of Rights section for student athlete safety. And I want to stress that part of the reason the university system was so involved and wanted to make major amendments is not because they don't care about the health and safety of student athletes. They have already done, there have been a number of reforms and changes over the past several years, but particularly the last 2 years. And they wanted to be sure that the bill is flexible enough so that they're not having to reinvent the wheel on things that they're already doing, but instead can robustly report to us how those things are going. So the amendment you have strikes a big part of the early part of the bill from page 2, line 28, all the way to page 9, line 9. But they retain the section about guidelines to prevent, assess, and treat serious sport-related conditions, exercise and supervision guidelines for student athletes with sickle cell and asthma, return to play protocols for athletes who've experienced injury or illness during practice. And they also add, and I think this is really important and a good change, a reporting requirement for the University System of Maryland, Morgan State, St. Mary's, and the Intercollegiate Athletic Work Group to come back October 1st of 2021 and every year thereafter to report on how these things are going. There's a few changes in the name, image, and likeness section that I think are good changes, including specifying that an athlete can't get an endorsement and be able to say, I'm a University of Maryland athlete and I play football or I play basketball at the University of Maryland. They're not able to use, copyrighted, any of the copyrighted branding of the university they go to. They'd have to just be their own name, image, and likeness. And there's a couple of other technical changes. And I'll be sure the committee gets a very clear specificity on what those are. I've gone on long enough, and I hope that my long-windedness does not, I hope it is indicative of how enthusiastic I am about the opportunity we have to really make an impact for our student athletes in Maryland. And with that, Mr. Chairman, I'd love to turn it over to my witnesses. I assume you'd like to have the panel go and ask questions.
If Senator, if you have the time, yes. If not, we can ask questions now.
I know I have at least one witness who has a little bit of a hard stop. So if it's okay with you, Mr. Chairman, if we could let them go, and I can hang around and answer questions.
All good. Thank you.
Thank you, sir.
Let's start with Mr. McNair from the McNair Foundation. And Mr. McNair, if you're with us.
Yeah, I don't see him, Senator Pinsky. I know Mr.
He may have only submitted written. He did testify in the House.
Okay, then let us go to Brian Hess, followed by Benjamin Bateman, followed by Dan Alpert.
Chairman Pinsky, members of the committee, thank you for the opportunity to testify today to offer my support of SB 439. My name is Brian Hess. I'm the Executive Director of Sports Fans Coalition. Founded in 2009, SFC is a national grassroots nonprofit advocacy group devoted to representing fans wherever public policy impacts the games we love. The NCAA, sports apparel and merchandise companies, and media conglomerates earn billions of dollars in sports-related revenue each year, yet professes to operate in the name of so-called amateurism. While college athletic programs often help students gain a college education, they too often extract economic gains from athletes while denying those young men and women a real chance to complete their degrees or otherwise share in the bounty created by the athlete's blood, sweat, and tears. Personally, when I was an undergraduate student at the public university, I tutored college athletes in the evenings. What I witnessed was disgraceful. The hours alone that my students had to dedicate to grueling workouts, frequent practices, extensive travel, and other team activities left them no time for academics. My students struggled to keep up with homework, study for exams, and reach their potential in the classroom. Outside of tutoring, if I saw one of my students walking across campus in the rain, I was strictly forbidden from offering them a ride, as it would be seen as a gift based on their status. In other words, I've seen firsthand the gap between what athletes provide to a state university and what that university offers in return. Mine's not an isolated experience. These unreasonable restrictions on student athletes are exactly why this bill is paramount to ensuring a positive student athlete experience for Marylanders. A student athlete should be able to earn compensation from their name and likeness. After all, it is their hard work that has created value for the brand. Why shouldn't they be able to prosper from it? Students also sacrifice their bodies for their school, many of whom suffering from lifelong conditions. Athletic programs absolutely owe it to the athletes to provide for their health and safety, because without the student sacrifice, there would be no athletic program. Today, college athletes have no organized representation, no lobbyists, no one. Absent an advocate, it falls on the shoulders of the fans to stand up for our athletes against the exploitation of the NCAA. Maryland's college athletes deserve more than the support of 40,000 sports fans. They deserve their senators. It is with that in mind that I urge the members of this committee to support SB 439 and take this historic step to protect Maryland college athletes. Thank you.
Thank you, Mr. Hess. Let's go to Mr. Bateman, please.
Ben, I don't believe, signed up. He's my Director of Gov Affairs, and I'll be speaking for the student government. I'm Dan Albert. I'm next.
Okay, you were next, Mr. Please continue.
Thank you. My name is Dan Albert, and I'm the student body president at the University of Maryland College Park. I'd like to start by thanking Chair Pinsky and all the members of the Education, Health, and Environmental Affairs Committee for the opportunity to share our thoughts on this vital bill. Thank you to Senators Reedy and West for sponsoring this legislation, which will level the playing field for student athletes. During the summer between my freshman and sophomore year, College Park suffered a tragedy in the loss of Jordan McNair. Jordan is one of more than 30 college football players who have died during an NCAA sanctioned workout since 2000. Jordan McNair's preventable death laid bare the vulnerabilities that our student athletes face and the unfair practices that are unique to them. This bill protects the health, safety, and future of student athletes in 3 key ways. First, by creating stronger injury protocols. Second, by protecting scholarships if there's a break in play. And third, by ensuring that student athletes have all the necessary resources to succeed in their academic and professional lives. This bill also follows the lead of more than 20 other states by allowing student athletes to earn an income off the use of their name, image, and likeness. It ensures that student athletes are receiving reasonable and fair benefits while they are representing the university. As a student who has previously worked for the athletics department, I know that many of our student athletes are not comfortable speaking out on athletic-related issues. In fact, when we reached out to student athletes, many were not comfortable with testifying on this bill, proving the importance of the anti-retaliation clause. We need our student athletes to know that their words and actions will not be held against them by the athletics department. It is for these reasons that we, the Student Government Association at the University of Maryland, urge a favorable report on the Jordan McNair Safe and Fair Play Act. Thank you.
Thank you. Let me start a couple questions, Senator Reedy. And I know we're going to hear from Mr. Page from the university. With the House amendments, are they on board or they still have problems?
My understanding is that the House amendments dealt with the issues of concern. I only got the House amendments maybe a couple of days ago. In normal session times, I'm sure we would have all sat down and had a meeting, but I'm not sure if something missing. I'm still happy to work on it.
And obviously we'll hear from Mr. Page in just a moment. 2 other questions in terms of name, image, and likeness. As I read Mr. Page's testimony prior to the amendments, they were concerned with being out of sync with NCAA on image and likeness. Have you given any thought of putting a date specific that if NCAA has not acted in allowing names, image, and likeness, then this would go into effect? maybe to put additional pressure on NCAA?
Well, I mean, that's an option. The reason we didn't do it that way is candidly, many other states that are doing this, including California and Florida, are not waiting for the NCAA. And I know there's people who will say, well, then can't the NCAA come in and punish us for doing it? They're not going. The NCAA is a regulatory body in the sense that they regulate college athletics, but they don't have a lot of legal power to overturn what a state is doing. So if we
when is the first state, Senator?
Florida has the same date as is on our bill. California's already passed, but I believe their effective date is a little bit later, but they've already passed in name, image, and likeness as well.
So no one has actually received money based on the change in law?
No, there's been plenty of people receiving money, by the way, in college athletics.
That's another bill. That's another bill.
Well, no, there's also been kids receiving money for a long time under the table from unscrupulous.
That's what I was referring to.
Yeah. That's another issue. Yeah, right.
Okay, one other quick question, and then I'll get out of the way for Mr. Page and any other questions. I saw the amendments dealing with the logo or something controlled by the university opposed to the student's name. I guess my question is, having been to plenty of sports activities, if a student's name is on a Terp jersey with the Terp colors, where does that fit in terms of the student getting credit or reimbursement for the sale of that shirt vis-a-vis it having the Maryland state flag or one of their Under Armour's creative coloring schemes? You're muted, Senator.
That's funny. I didn't know I muted myself. Huh? It's fancy. The way the bill is designed, and this is how we wrote it to work. If you ever watch television commercials with professional athletes, you will sometimes see a professional athlete that you'll see Aaron Rodgers in a green and gold outfit, but it doesn't say Packers on it because that's not a sponsor of the NFL. So it would be the same concept. Yeah, I mean, you could have a Maryland color shirt that says, Smith on the back or whoever's a famous athlete, as long as it does not have the logo likeness, the logo or the brand of the university, he'd be in the clear, or she'd be in the clear.
Okay. Senator Ellis.
Yeah, thank you, Mr. Chairman. Senator Reedy for this very timely bill. I remember it from last year and had some questions last year. Since it's back, I just want to kind of align with my concerns from last year. So student athletes, they're both students and athletes. It was mentioned that most of these students will not make a professional career out of athletics. So it's in the interest of the students, the parents, and I would think the state to make sure that they get properly educated. So going to school, classwork is hard. Athletic practices and the travel schedule, double down on that. So I love your proposal for a 5-year scholarship for these students. But to say that they would go and say, do a camp here or there, that means they'll be doing more work. So I remember when I graduated from high school, I was blessed with a ROTC, Air Force ROTC scholarship, type A, the best one they give. They paid for my tuition, room and board, and also received a stipend. Okay, I got a monthly stipend, which paid for a lot of my living expenses. Why not just give the students a stipend along with their scholarship? It's done by other organizations, and I can say others also, but I'll just stick it with that one.
Yeah, no, it's a great question. And I think that is sometimes a little bit of a debate that happens within the circles that are pushing for more economic empowerment for student athletes. Some people like the name, image, and likeness a little better. When you begin to start paying athletes as paid employees, and I know a stipend's not the same thing, but let me elaborate. When you pay athletes as paid employees, you open up, there's a lot of issues that come with that because Are we going to pay every single student athlete the same, whether they're in a non-revenue sport or a revenue sport, or you can imagine the issues that come with that. And obviously there's a lot of widespread opposition from the universities, not just Maryland, but all over the country on that. The stipend, some athletes in some of the sports get a cost of attendance stipend. They might get like a couple $100 a month as like, they get like it's called cost of attendance, I think, in the college football world. I'm not sure if it's called that in every sport. But the reason I like the name, image, and likeness is a scholarship is actually a great thing. If you have a full ride scholarship, that is an amazing opportunity. And, as long as we can protect your right to actually pursue whatever academic ventures you want to pursue, as opposed to being told you have to take underwater basket weaving so that you can be available for practice, which that's kind of, hopefully a lot of it's been phased out, but it still can be an issue. But the name, image, and likeness allows you to go out and says, we're going to be sure that if you can go out and earn more than just a stipend, that you should be able to do that. And again, it's sort of like with Olympic athletes, they can go get sponsorships and still be eligible for the Olympics. That's the concept. I mean, I'm not really against the idea of a stipend, but you do run into the issue of, I went to Salisbury University, so name, image, likeness will allow a Salisbury University athlete to go out and earn money based off their name, image, likeness. Obviously, their ability to do that will be much more limited than a University of Maryland athlete. But Salisbury University can't afford a stipend for all their athletes. It just, the smaller schools would really struggle with that, whereas bigger programs like the University of Maryland might have boosters that could help pay for a stipend. So it's NIL is sort of it's like it equals it out, that you can go out and pursue opportunities. It's not always a car dealership going to be like your sponsor. Like I said, it could be doing a camp, or it could be offering lessons, or it could be whatever. And I recognize what you say. A lot of these athletes they may not have a lot of time to do extra things like that, but I just think if we ought to allow it if they can.
What percentage of students do you think, say at my alma mater, College Park, University of Maryland College Park, would say have the name recognition, Q score, to really make anything from their name and likeness?
I don't really know the answer to that question. And I think it might take a while for that to get worked out. I can tell you that there are a lot of schools pushing that will be taking advantage of this in other states. And I imagine that they're already working on ways to help their athletes maximize their Q score. And I can tell you this, I'm a Southeastern Conference football fan, college football fan, and I can tell you University of Alabama, which is always the team I sort of grew up rooting for, they have players making lots of money now that were successful players in the 1990s, and they're very successful in real estate and commercial development and all kinds of things it started because they were a well-known athlete at the University of Alabama. That's obviously after they were playing. But my point is, I think there could be a market for a player, even if they're not that well known. But it's not a perfect system. I mean, it's not going to be equal for everybody. But to me, it's more of a free market way to do it. That, if you can go out and if there's an ability for you to be sponsored or ability for you to go out and, like I said, do something that uses your skills and abilities now, you ought to be able to do that. To me, it's more about allowing it as opposed to ensuring that everybody maybe gets an equal share. You're getting, so I don't have an answer to your question specifically because I don't know, but I imagine it's more than you would think.
Let's go on to Mr. I'm sorry. Let's go on to Mr. Page. We have one opponent unfavorable from the USM, and then I'm sure there may be more questions. Mr. Page.
Thank you, Chair Pinsky, and thank you, Vice Chair and the members of the committee. My name is Robert Page. I'm the Associate Vice Chancellor for Financial Affairs at the university system. And in that role, one of my duties is to support the current Board of Regents work group overseeing intercollegiate athletics. You have our written testimony, and the written testimony is specific to the bill before the Senate committee today as written, as opposed to the amendments that are being worked on the House bill, which have to say first that we're really appreciative to Senator Reedy and Delegate Weirman for their willingness to hear out the institutions of the university system on this very important bill. I just have to say, both last year when the bill was introduced initially and this year, the bills reflect the same sets of values and goals that our institutions in the regions hold. It's just a couple of practical considerations that I think are getting worked through in the amendment process that have us asking the committee to report out unfavorably on SB 439 as it's written. So, one of those sets of concerns are the fiscal impacts associated with some of the mandated scholarship and health and support provisions in the bill as written. Our institutions that have intercollegiate athletic programs span a gamut from Division III institutions, which are prohibited from affording their student athletes scholarships, all the way up to the University of Maryland College Park, which, as most people know, participates in the Big Ten and supports its programs significantly with conference distributions that arise out of media rights. Now, the reason I point this out is that the other institutions that operate intercollegiate athletic programs in the university system generally fund those activities with student athletic or student activity fees that get charged across the board to all students enrolled at the institution. That's quite a bit different than what happens at major Power 5 conference institutions, where conference distributions and contributions from fans provide significant amounts of support to operate intercollegiate athletics. Any cost increase at one of the other non-Power 5 institutions ends up resulting or driving increases in student activity or student athletic fee rates that are used to support intercollegiate athletics. And that's the concern that our institutions have raised about some of the provisions that were sort of wrapped up in what was called a Student Athlete Bill of Rights. The other set of concerns we have, and I think Senator Reedy touched on it, was the timing of the initiatives and the legislation and the interactions between NCAA moves to enact name, license, name, likeness, and image provisions, the federal government, and then also the state in legislative initiatives, and the potential that the outcome will be conflicts between the three. And those would put some of our institutions, they believe, in jeopardy of being in conflict, not just with the NCAA, but with their conferences. And so to the extent that we can pursue amendments to the House bill, we feel that that process is going pretty well, and we're really grateful for the collaboration, and we want to get to the right answer. In summary, I'd ask an unfavorable report on SB 439 as it sits, but we completely support and encourage efforts to amend the House bill in the way that it's going. Thank you.
Thank you, Mr. Page. Questions? Mr. Senator Ellis has one.
Yeah, thank you, Mr. Chairman. So question for Mr. Page. You mentioned conflict between federal law, state law, and say NCAA rules. I was going to say NAACP, but NCAA rules. So, I mean, those conflicts exist now. So what's the way we handle those conflicts? Federal law, state law, and say association law or rule, association rule.
Well, think that any of our institutions want to be in conflict with any regulatory or legislative requirement that's been adopted. And currently, we don't think that we are. But the possibility that states, and we're seeing the same thing that Senator Reedy and Delegate Wehrman is across the country, to the extent that states adopt legislative initiatives that deal with this, that conflict with prospective federal or federal legislative requirements or NCAA rules. Those are the concerns that we'd be worried about.
Yeah, so I understand your point, sir, but my question is, currently under, say, states' constitution, the federal respects state laws in a lot of areas, like in reference to Social Security, a lot of times, Medicare, marriage. So if you have a federal law that conflict with, say, a state law, I mean, in this area, wouldn't the state rule take precedence?
No, Senator, the federal law will supersede any state law. Now, federal law is different from NCAA law.
Right. That was the other part of my question.
Well, the federal supersedes any state law. Generally, I'm not a constitutional lawyer, but that's my understanding. And even a federal law would supersede any NCAA policy. But short of a federal action, many universities will accede to what the NCAA offers because they don't want to be in conflict, however much of a Neanderthal some of us feel NCAA is. So it is a tripartite situation, and some trump others by law, some trump others by will.
Okay, thank you, Mr. Chairman.
Okay, I'm sorry, I had Senator Gallion.
Thank you, Mr. Chair. This is for Mr. Page. You had mentioned that the House version had been amended and you were okay with it. I was just curious. I know that Senator Reedy has been working hard with the House sponsor. So if we got that in the same form and Senator Reedy was okay with that, would you drop the opposition, be good with it?
Yes. Like Senator Reedy, we received, or I first saw the amended House bill late last week. So we haven't, and we've been trying to pull together feedback to the bill from the athletic departments, who likewise have only had a short period of time to deal with it. But the initial reaction that I'm getting is that the bill is trending toward a place where all concerns have been addressed, including the name, image, and likeness provisions, to the extent that we can defer the effective date for some period of time to give the federal government and the NCAA an opportunity or a window to adopt and resolve some of these questions. Even those sets of issues about potential conflicts get mitigated.
Thank you.
Thank you, Mr. Page. That helps a lot. If there are further amendments, not that I want to encourage further amendments to the House or Senate version, you should let us know soon. If you're almost there but want to be quite there, if there's some other, hopefully minor changes that can help in implementation, please get them to our committee council.
Mr. Chairman, I've been conversing a little bit via text with a couple of folks. So I think we're either there or we're real close. So I'll be getting that all to you very fast.
We will wait till we hear from you, Senator Reedy. Okay, that concludes the hearing on the sports bill, although the next Reedy bill is also dealing with athletics. Although this one,
quicker, Mr. Chairman.
He is the only witness with oral testimony. There are a number of written and a couple are unfavorable, so you should check your file. MABE is against it, and Anne Arundel Public Schools are against it. But let's hear from Senator Reedy and let him get back to his committee.
I always appreciate your inspiring lead-ins, Mr. Chairman. I'm glad we could do the other bill first because these are two totally separate issues. So hopefully we can divorce the two in our minds.
We take each bill on its
Yes.
own merits.
Thank you, Mr. Chairman.
And we haven't analyzed these merits on this bill either.
I understand. So Senate Bill 759, Mr. Chairman, happy to be here again. Senator Reedy for the record to present Senate Bill 759, which is the State Department of Education Interscholastic Athletes Eligibility Waiver for Graduate Athletes. And this bill really is responding to, this was brought to me by some coaches and also parents, this idea. We are in incredibly unusual circumstances. Obviously, that's the understatement of the century, literally. And it's been a very difficult time for so many people. And we really, all of us have experienced hardships this past year. Obviously, I feel tremendously blessed that I know a lot of people have it way worse. Some of us have dealt with, being down or a little bit of depression or having to not be able to do a lot of things we love to do. But many people have lost jobs or they've had to forfeit a lot of things that they need. This is an issue where there are students who have really made big sacrifices. All of our students have had to make sacrifices this year. But responding to the unusual circumstances of the past year, Senate Bill 759 would grant current high school seniors one more year of athletic eligibility at the current high school that they attend this year. It would allow them to play their sport in the next season. They would have had to have been eligible this entire year. And we know, students were forced to sacrifice, in many cases, all or most of their final year of different high school sports. In some cases, some of the fall sports are getting a little bit of action this spring in some counties, but in other counties they're not. It's been very difficult. We want these students to, if they're staying around, if they're not going off to college, to have an opportunity to continue to compete for one more season, one more year. I also think, in addition to helping really any of these student athletes who may be attending community college or not moving on to college yet, an opportunity to play their sport one more time, there's also a number of opportunities to compete for scholarship, where someone might be on the very edge of being eligible for some kind of scholarship or some kind of help in college, but they didn't get enough film or they weren't able to get quite enough experience. So this is to kind of do two things. One is to give folks a chance to play their sport one last time, to help particularly small communities like I represent. We have small high schools and always a little bit thin in some of the sports that require more players. And so it's an opportunity for those to have one more year, but also to give student athletes a chance, one more time to gain some attention for possible scholarship opportunities in high school. Sports just mean a lot to the communities that we all represent. They should never be given outsized importance compared to health or compared to other important academics, certainly. But I thought this might be a nice way for us, an interesting way to enable this to happen. I don't believe that many students would take advantage of it, but I think some would. And so that's the bill. It is a 1-year waiver of athletic eligibility. I admit it's a little unusual. It almost is kind of like at the college level, they're giving students an extra year of eligibility. I know it's a little bit kind of apples and oranges, high school and college, but that's the bill. I would ask for the committee's favorable support and happy to answer any questions, Mr. Chairman.
Yeah, look, Senator, I think we all know it's an odd year in many respects, and there are going to be lots of asterisks around.
Give me 2 seconds on this.
Aspects of this year. Senator Kagan.
Thank you, Mr. Chairman. Sorry, I unmuted too fast. Senator Reedy, I know that you are well-intentioned in this. It provokes 2 questions for me. One is thinking of kids, and I know this is high school, and so not kids, but if you let the 7th grader play against the 6th grader, maybe the 7th grader is smarter, bigger, more talented, more experienced, whatever. So you'd be basically putting a 13th grader up against 9th, 10th, 11th graders. So if you could speak to that, has that been done before? What's the difference or the sort of thumb on the scale, lack of equity on that? And then the second question, and this is a little harder to speak maybe, which is, are we putting these athletes into a high school ghetto of some sort of like not being able to go to college or trade school or start their career, and almost holding back in the hopes that something works for them athletically. Can you speak to either of those, please? Thank you, Mr. Chairman.
Yes. So on the first issue, I don't know that this has been done before anywhere that I know of. There may have been some instances where it happened. I think when you're talking about one of the things different about athletics than, say, somebody playing in the marching band, someone could come back and play in the marching band, in fact, probably do, or come back and perform in a school play as a freshman level in college. There usually would be some sort of paperwork probably involved to become a kind of a volunteer. Whereas athletics, obviously you pointed out, it's a competitive endeavor. Not that music's not sometimes, but athletics particularly is a competitive endeavor. I think in this case that you're talking about, typically in a high school, the sports where you usually have seniors and juniors playing at the highest level, not always, but usually, I think having a young man or young woman that's 18 and a half or 19 instead of 18 or 17 is not the end of the world for 1 year. I certainly wouldn't be putting this bill in permanently, but for 1 year. But that's a fair question. I mean, it's something to sort of a policy call. And then the other question about keeping a child trapped, that's really interesting because this bill wouldn't keep somebody from enrolling in community college and still playing a high school sport, or enrolling in a trade school and playing a high school sport. I tried to be careful not to overemphasize the scholarship opportunity as I talked about this. I do think there are kids who could be on the edge of maybe getting that Division III or Division II, like partial scholarship. The kid who's really a superstar athlete probably is already going to have some scholarship offers that they wouldn't be staying around. And I don't know that there's that many kids that if they really had a good college opportunity would want to hang out at mom and dad's house or for another year. But again, I think it's a policy call. I mean, I understand the concern. I do.
I appreciate that. Thank you, Senator Reedy. Thank you, Mr.
Senator Fry Hester.
Thank you, Mr. Chairman. It's good to see you, Senator Reedy, my fellow Carroll County Senator.
Yes.
I'm curious, so is there a sunset on this bill? Is it just like a one-time thing?
It's just for this next count. It's just for this class, basically.
Right. I mean, I think it's a really interesting conversation to have. And for me, I started going down a rabbit hole of like, well, what if there's a senior who actually wants, the senior completely missed, they didn't completely miss, but they were online for most of their senior year. What if they actually wanted to repeat their senior year just so they can up their grades and then apply?
Well, now you're talking about a whole nother, you're talking about quite an interesting, this is not going back and finish and doing more grades, but yeah, that's interesting.
But they did miss out on a lot of things. So anyways, I like the bill, and I think it's a lot different type of policy for 1 year following a pandemic than it would be for, ongoing. So thank you very much.
Yeah, Senator, let me just say in concluding, Division III can't give athletic scholarships. That's prohibited.
No, they can't, but there's ways they work things out. So
yeah, they give an academic. Now they give financial support, but they can't explicitly give sports.
No, that's true. That's true.
Right. I think sports collegiate recruiters are doing things differently too. They're looking at people's junior year experience and hoping it's going to improve, or they're betting it won't, or other people. I think the people it might affect are people who are hoping for Division I and haven't gotten any offers, who may be dreamers. Because,
well, I know you support dreamers, Mr. Chairman, so.
But I would hate to hold back someone from attending a college when they're ready, just with a hope and dream that they're going to get seen all of a sudden by a four-year college. But I understand it. I'm sympathetic. I'm not sure I'm convinced, but I'm sympathetic. Okay, seeing no other questions, no other oral testimony. Senator Reedy, thanks for joining us.
Thank you, Mr. Chairman. Thank you, committee member.
In front of EHE. Okay, Madam Vice Chair, you have the next bill?
Yep, I do. Senator McCray is back in EHE, it seems. Senate Bill 526, Legal Education Success Collaborative, established. Do we see Senator McCray? If not, we can go to another bill. Lemoria, do you see Senator McCray? Is he on his way in?
So he is. I spoke with Tamika, and this was about 5 minutes ago, and he was supposed to be on his way in.
All right, well, let's skip. We've
want to
got,
go ahead with Senator Gallion.
we can go to Senator Gallion, Senate Bill
Okay.
584, Education, Student Horizon Database and Scorecards, Student Right to Know Act of 2021. In addition to Senator Gallion, we will have Therese Hessler, the Foundation for Government Accountability, and Angeles Juarez, representing Angeles Juarez. Okay, Senator Gallion, you may begin. Always good to have
Thank you, Madam Vice Chair. Good afternoon, fellow committee members. I'm here to introduce, for the record, Senator Gallion here representing District 35, Hartford and Cecil counties. Here to introduce Senate Bill 584, Education, Student Horizon Database and Scorecard, Students Right to Know Act of 2021. This bill is a cross-file by request of one of the delegates from my district, Delegate Mike Griffith. This bill requires the State Department of Education, in collaboration with other specified agencies, to annually collect specified information on jobs and post-secondary education, including the most in-demand jobs in the state and average cost of attendance. Using this information, the agencies must create and maintain a searchable Student Horizon database. Senate Bill 584 is designed to address the cost of education, but also align our education system with our current job market. This bill aims to accomplish several things. It wants to provide young people and parents with all the tools they need to make decisions about work, school, and their futures. We want guidance counselors to have the tools they need to guide students in making important decisions for their future. This bill will provide a one-stop place for high school students in Maryland, whereas the federal government's College Navigator is more of a host site that links to external sites for information. Quite simply, the goal of this legislation is to make it simple for young Marylanders and their parents to have one easy access spot to access information on continuing their education in Maryland, as well as the potential costs. The Students' Right to Know Act invests not only in our students, but in our colleges and universities, as well as our trade programs and schools, with positive long-term impacts throughout our communities. I thank you and turn it over to our panel.
Perfect. Thank you very much, Senator Gallion. Therese Hessler, the Foundation for Government Accountability. Welcome to EHE.
Thank you, Madam Chair. Good afternoon, Vice Chair, Chair, and members of the committee. My name is Teresa Hessler, and I'm here representing the Foundation for Government Accountability in support of Senate Bill 584. This bill will help Maryland address a growing problem in the United States. Currently, the average Marylander's student debt specifically totals more than $42,000, which is the second highest in the nation. This legislation would help young Maryland students by increasing access to important information on the cost of college, other training opportunities, and potential earnings data. This information will be delivered directly to its intended audience. It is smart, it is practical, and it is necessary. How many of us knew what college would cost when we were leaving high school? How many of us knew what our monthly student loan bills would be, or even had an approximation? Between 2014 to 2016, nearly 4 million undergraduates with student loan obligations dropped out, not benefiting from any income increase from college, but suffering much of the debt. Unfortunately, those who do not graduate have a default rate 3 times higher than those that do. There are a multitude of opportunities available to young people, and there are ways to optimize the education experience and to keep the costs as low as possible. They just need to know about them, and this bill does just that. There are also opportunities outside the 4-year bachelor's degree process. With the average cost of college growing at a rate almost 8 times faster than wages, now is as appropriate a time as any to explore those options. I politely ask for a favorable report on Senate Bill 584. Thank you.
Thank you, Teresa. It looked like Therese, so sorry I mispronounced.
No, that's okay.
Okay. Angeles Juarez, am I close or is it Angeles?
No, you're correct. Thank you so much, Madam Chair. Good afternoon, Vice Chair and members of the committee. Thank you for letting me speak today in favor of Senate Bill 584, the Students' Right to Know Act. I'm Angeles Juarez. I'm a 17-year-old student at Annapolis High School. I'm currently a junior in the International Baccalaureate program, which is really heavily college-oriented for many scholars. I think that this bill would bring tremendous change forward in regards to how students who would like to attend a higher education institution are able to shape their future with information they can gain from their schools and state government. Personally, I'm a first generation student who is discovering what it is like to be independent and self-sufficient. This brings its many challenges, which teaches me about life and other things, but it also brings its many joys and discoveries. Education has had a strong foothold in my life, and I think it is a great privilege to have. I believe that this bill would bring positive change towards my ability to figure out where I want to go to college and how I will navigate that financial responsibility, especially during this pandemic. I think students alike will agree that when we get information that is helpful, we would like it to be direct as possible because we have a bunch of other things going on. And these problems really begin as soon as college applications start. I'm really excited about the future, but this kind of curiosity about school brings awareness to me and other students of color, students in the workforce right now. It really demonstrates that we have to figure out how to pay for college in our near future. And I know that student debt right now in America cripples a lot of adults. There is a lot of appreciation for any tools and resources we students will have to figure out the best route to follow, especially during these unprecedented times. Aid to families will motivate students to explore the options they have available at high school. I politely ask for a favorable report for Senate Bill 584, please. Thank you.
Thank you, Ms. Juarez. Nice to have you here. Thank you both for your testimony. I have a question for either the sponsor or the witnesses, very briefly though, because we do have Senator McCray, who is now with us, I think, still. Senator Gallion, yes, he's here. This proposes or assumes that people might pick a career path or an academic path based on the amount of money they could get out at the tail end. Have you given any thought as to what that would do for social workers, for nurses, for legislators, for people who don't earn a lot of money? Would this be a disincentive, or how would this not be a disincentive? We had this bill several years ago. Actually, Senator Hester's predecessor brought this, and I think we had it a couple of times. I wonder if you or one of your witnesses might speak to that.
I would, if Teresa would like to answer that.
I can certainly speak to that. And I think that's a great question. The goal of the legislation is really to make it transparent and have all different types of aggregate data in one place. It's not to necessarily say, well, this career makes this amount of money, so that's why I'm doing it. But I think it's important for people to know when they're picking a path, what the possible debt to income ratio is. So if you would like to be a nurse, what the average salary is, but also what the cost is to get there so you can plan accordingly. And for some people, it might mean that they need to work a job or figure out a variety of financial assistance or whatever that looks like. And it's really just to be transparent with the data, if that answers your question.
That's a good answer, Ms. Hessler. Thank you very much. Colleagues, I see no other hands up. I just want to flag that among those testifying favorably is the Parent Advocacy Consortium. And that's one more favorable. Everyone else was informational, and that's the Department of Education, the Maryland Higher Education Committee, and the University System of Maryland. They were all informational only. So seeing no other questions, thank you, Senator Gallion. Thank you, witnesses. We appreciate your being here. That completes the hearing on Senate Bill 584. And now we go back to Senator McCray, who is with us. And we tried to take you before, Senator. Sorry to keep you waiting. But Senate Bill 526, Legal Education Success Collaborative, established. You will be followed by Ronald Weiss, and then Dean Donald Tobin, who I already saw in the room, Maya Dolby, and then Randall Ainsworth, in that order. Thank you. Welcome back to EHE, Senator.
Thank you, Madam Chair, and thank you, members of the committee. First, want to apologize for my tardiness. For the record, Corey McCray, Senator for the 45th Legislative District, here for Senate Bill 526, Legal Education Success Collaborative. This bill was heard before this committee just last year, did not come up for a vote, but this is sheerly a bill where we're trying to increase the amount of lawyers that are minorities, African Americans within our legal space. This is a combination between our 2 law schools in the state of Maryland. And as you stated, I'm going to be joined by Dean Weich, Dean Tobin, and Maya Dolby, who can give more specifics about the program. Just some numbers so that everyone knows. Nationally, 5.10% of legal associates are African American. Only 2.10% are law partners. And African American women make up only 0.8% of all law partners, 3.4% of legal associates. And we all know that we can do better than this. There was a program that was funded privately, the Fannie Angelos program with the University of Baltimore, that had a great model working with the HBCUs in order to achieve this goal. This is where the state would be able to help with achieving this goal. Madam Chair, also see that it was an amendment that was put forward with this bill because it's actually jointly assigned with B&T. And what we did in that amendment was we restricted or lowered the funds down to $250, $125 for each law school, and removed the HBCU navigator. And this is palatable so that it will be able to make it across the B&T finish line and get to the Senate floor from that standpoint. So we worked out the budget concerns with the respective issue. I'm going to stop and let the subject matter experts do the talking, but I would just ask for a favorable report for Senate Bill 526. Madam Chair, you're on mute.
Yeah, I got it. Sorry. Okay. Thank you, Senator McCray. Ronald Weiss, University of Baltimore School of Law. You're the lead witness. You have up to 5 minutes. You may begin.
Thank you very much, Vice Chair Kagan, and thanks to the other members of the committee for hearing us out. And I especially want to thank Senator McCray for his leadership on this issue. I know we have with us several other co-sponsors, Senator Lamb, Senator Washington. We appreciate them all. I'm so proud. I'm Ronald Weich. I'm the Dean of the University of Baltimore School of Law, and I'm very proud to join with my Dean colleague, Donald Tobin from the University of Maryland School of Law, and students from our programs who are here today to endorse Senate Bill 526. As Senator McCray explained, this is a bill that would support existing programs at both law schools that would strengthen our efforts to diversify the legal profession. As the only 2 law deans in the state, we feel a sharp obligation to make sure that we're recruiting and giving all students from all of Maryland's diverse communities the opportunity to obtain legal education and then to graduate lawyers who are going to serve this diverse community and represent the diverse community. At our school, the Fannie Angelos program, named after a pioneering alumna from our school, is a partnership with the 4 historically Black colleges in Maryland. My written testimony describes the program in some detail, but in essence, we identify and recruit and mentor students from those undergraduate institutions to make sure that they enter law school well prepared and are prepared to succeed in law school and beyond. More than 100 graduates of the 4 Maryland HBCUs have come through the program and have found success in the legal profession. So this is a very successful program. It's been recognized by the American Bar Association with the prestigious Diversity Leadership Award. And I want to note that we would not be in Maryland the only state to encourage and support this kind of activity. The state of California, the legislature there appropriated $4.5 million to support HBCU students to attend the Hastings College of Law, a public law school in California. So Maryland would be following in that fine example. I know my colleague Dean Tobin is going to describe the program at his school, and really the 2 programs are complementary. Ours focused on admissions and his focused on placement. And together, we're working together to make sure that the legal profession in Maryland represents the state and is well prepared to represent the people of the state. Thank you very much.
Thank you, Dean Weich. Appreciate your testimony. Dean Donald Tobin, University of Cary School of Law. Dean? You get up to 2.5 minutes.
Thank you. Thank you, Vice Chair and members of the committee. I'm so excited to be here to talk about SB. And I tell you, my information just went off the screen, which I cannot tell you why it did that, but I will get there. Sorry. So what we've done at Maryland is a little different than what Baltimore does. We've been looking at it as a recruitment of diverse students. In 2017, we started a process of our diversity and inclusion scholars. And what we've done as part of that program is gotten law firms and businesses to help join with us in order to create ways to recruit, retain, and help diverse students succeed. And we found that that this is a critical part of an infrastructure to get great students to Maryland, but also to make sure that they succeed while they're there and that they have the vision of being able and going out into the world and doing great things. And we're obviously very proud of our alums who have continued to be major leaders in the state. We are, as a law school, we're the #1 law school in the country who are ranked in the top 50 for African-American enrollment. We've taken our obligations there very, very seriously. And what we need to do is find ways to create these pathways of affordable education and success for our students. So today you're going to hear from one of our most recent scholars, which gives you a sense of what we're trying to accomplish. Randall Ainsworth, he's a shining example. He's a diversity scholar. He's our first Elijah Cummings scholar. He's from Baltimore. He attended UMBC. He actually has worked in Annapolis, so we're excited he gets to testify here today. And he was heavily recruited by law schools. And so this is a way for us to get our best and our brightest from Maryland to go to Maryland and stay in Maryland. And we think that's really important. True justice in our society requires that all members of society feel a sense of belonging, that the legal system is not stacked against them, and that justice is not just for a few. And we believe that the legal profession that looks like our citizenry serves important promotions of justice for all. SB 526 helps us achieve that task, and I strongly urge the committee to provide a favorable report. Thank you.
Thank you, Dean Tobin. We appreciate your testimony and your activism on this issue. Maya Dolby, University of Baltimore School of Law. Welcome, Ms. Dolby. You have up to 2.5 minutes.
Thank you, Madam Chair, and also thank you to the members of the committee. My name is Maya Doby, and I am a graduate of the University of Baltimore School of Law, and I was also a scholarship recipient of the Fannie Angelos Program of Academic Excellence. I was actually recruited by the program in undergraduate. I attended Bowie State University, a historically Black college and university. I am so honored to be able to testify on behalf of the program in support of Senate Bill 526. When I was 13 years old, my brother was shot 6 times, and my experience with the justice system was not a favorable one. And it was at that time that I decided and knew that I wanted to be an attorney. But I did not know what that would look like, and I didn't know what exactly becoming a lawyer would entail. Senator McCray gave some of the statistics with the legal profession, 5% being African-American, and becoming a lawyer just did not seem like a reality in my world. But I received a full scholarship to go to the University of Baltimore School of Law through the Fannie Angelos program. I graduated, like I mentioned, in May of 2020. And I'm so happy to announce that I passed the bar exam on the first time taking it in a global pandemic. And I am now clerking on the Court of Appeals for the Honorable Shirley M. Watts. So I believe that my life and my story is a testament to what this bill will do and why it's needed, especially for the programs at the University of Baltimore School of Law and the University of Maryland. Without this bill and without programs like this, students like myself, young legal professionals like myself, would not have the opportunity to enter the legal profession in the same playing field as other people, as my colleagues have. So this bill is necessary. What the Fannie Angelos program does is searches for talent with the 4 HBCUs in Maryland. 8 scholars are selected, and we're supported throughout our entire time in law school, whether that be through mentoring, tutoring, financial resources, all of the above. We truly are a family. Me and my friends, many of us graduated in the top percentiles of our class. I have other friends who are—
Dolby, I need you to wrap up, please.
Oh, yes, thank you. Who are also clerking at the state Supreme Court. So I would like to end by saying I urge the committee's favorable report of this bill because our lives are a testament to what it can do.
Ms. Dolby, first, I'm so sorry about your brother. and for your experience as a young person. But I am sure I speak on behalf of the entire committee when I say how proud we are of you, of your successes thus far. And we know you're going to go very far. So we look forward to seeing and hearing more about you. So congratulations. Mr. Worth, you were described as a shining star. I think the bar set pretty high by Ms. Dolby, but welcome to EHE. You may begin your testimony.
Thank you, members of the committee. My name is Randall Ainsworth. I'm the inaugural Elijah Cummings Scholar for the state of Maryland. I've gotten a clerkship with McGuire Woods for the summer after my first semester of law school, and I have strong support for Senate Bill 256. I was born and raised in Baltimore to a single parent home. My mother told me I was born with 3 strikes against me. I was from a single parent home. I was poor and I was Black. And she told me that good enough was never enough. So I had to strive in order to level the playing field. I've experienced economic hardship, prejudice, and homelessness. I spent much of high school finding places to complete assignments because I lived in a home without electricity, and winter was hardest because daylight was few and far between. It was a symbolism for my life. One of my hardest memories was when I ran for student government in high school, and I didn't win. I was told that the deciding factor was that the kid's judge, the kid who won, his father was a judge. And that made him more valuable to the school. It made him more valuable to the world. And it made him more valuable than I was. And that was one of those strikes that I was told about. His dad wasn't just a judge, but his father was also present. And that was the second strike. It was a hard lesson to learn. But the point is, my story is one of many, from inner city youth who are bright, capable, and eager, but they have those same 3 strikes against them. Kids who don't have fathers that are judges, kids who don't have money to fix their problems. The Diversity and Inclusion Scholarship is a way to level the playing field. It's afforded me the opportunity to attend law school debt-free, and it's given me an opportunity to begin life with 1 less strike lingering over my shoulder. The scholarship has given me a new definition of like kind. Like kind no longer means being the poor kid or the kid without a dad or even the Black kid. Now, like kind means having other individuals with a dream, focus, and a passion for the law. I'm grateful for this scholarship, and I'm an advocate because of how it has benefited me and also for how it could potentially change the lives of those coming behind me. There are kids right here in Baltimore where there's violence and poverty and hopelessness, and they need hope. They need an opportunity to be redeemers of their bloodlines and to change the dynamics of their families. And without these scholarships, many will never have a chance to reach their potential, and they'll stop dreaming. As a University of Maryland law student, in 2 years, I'll be an attorney, the first one in my family, and one day I'll be a judge. I'm an agent of change, and there are others like me. Like pearls, we are a product of our environment. Our environment makes who we are.
Mr. Ainsworth, your time is expired. Can you just wrap up, please?
Yes, definitely. All we need is an opportunity, and the Diversity and Inclusion Scholarship gives us that opportunity. For those reasons, I ask you to support Senate Bill 526. Thank you.
Thank you, Mr. Ainsworth. Thank you for sharing your life story, and congratulations on all of your successes. Colleagues, are there questions? I see no raised hands. Seeing none, I think you guys have been very persuasive. We do have the amendment from Senator McCray from the Budget and Taxation Committee, and that will complete the hearing on Senate Bill 526. Thank you, Senator McCray. Stay well.
Thank you.
Thank you very much.
The next bill is Senate Bill 654. Is Senator Klausmeier with us? Yes, I see her.
Yes.
Senator Klausmeier, this may be brief. It is Senate Bill 564 is Education Comprehensive Health Education Program Instruction on Skin Cancer. Following Senator Klausmeier will be Victoria Flowers. Welcome, Senator Klausmeier, back to EHE.
Okay, thank you. Senate Bill 654 requires each local Board of Education to include instruction on skin cancer, otherwise known as melanoma, in their comprehensive health education program. Currently, Maryland students must complete a half credit of health in order to graduate. State law requires school systems to teach various health topics from drug addiction to safety, injury, and prevention. This legislation would simply require that melanoma be included in that education, even if it's just a half hour. Not only is skin cancer the most common type of cancer, but it is more likely to spread than any other types of cancer. With that being said, Marylanders are better equipped to prevent melanoma than other cancers by using sunscreen and not being in the sun for long periods of time. It is important we make sure that young Marylanders have information on how to prevent melanoma so they can make informed decisions about their actions. Today, I have with me Vicki Flowers, who lost her son Nick to melanoma in 2016. She's here today to share her experiences to stress the importance of educating Maryland's children about the dangers of melanoma. And I've always said, we always, up until I guess last year or the year before that, we always would have the bill to outlaw or just say that you have to be 18 to go to one of those beds where you get suntans. And my point was always, we have to stress to people, young people, that they need to wear sunscreen. They shouldn't be out in the sun the way they are down in Ocean City and everything else. But we need to stress and stress and stress this to them. So that's all. And I thank the committee for their consideration of Senate Bill 654 and ask for a favorable report.
Thank you, Senator Klausmeier. Victoria Flowers, I'm sorry for your loss. Please share your testimony.
Thank you. Good afternoon, Chair Pinsky, Vice Chair Kagan, members of the Senate Education, Health and Environmental Affairs Committee, and thank you, Senator Klausmeier. My name is Victoria Flowers. I am a Baltimore County parent and resident, and I'm here today to ask you to give this bill 654 favorable consideration. Personal tragedy is what brings me here today, and that is the passing of my oldest child at the age of 24 from melanoma. Cancer, as most of you know, is horrific, and skin cancer is by far the least spoken about disease. This is insane to me because your skin is the largest organ of your body. It's impossible for me today to go into so much detail about the medical literature in my allotted time. Educating all children about protecting their skin while in school is imperative. This can be done at age-appropriate levels, from simply teaching them about sunscreen and reapplication while outdoors, to avoiding tanning beds, to wearing UV protective clothing. I do understand why this or any legislative body might be reluctant to direct or prescribe what is taught in schools. But that's why this bill is flexible in terms of method of education, whether it's a simple lesson in a health class, a speaker at a school assembly, or even an educational pamphlet that would go home to the parents. The important thing is communicating the risk involved with sun. There is no different than any other health and wellness messages shared with students in a school meeting. Had all this been in place years ago, maybe things would have been different for my family. Unfortunately, I will never know because we can't go back in time and change things. We can only do better jobs for future generations. I alone could not save my son. His doctors tried with various surgeries, along with radiation and immunotherapy treatments, but nothing could stomp out the beast that he fought. As a parent, I could only sit there, stand there, and watch as he endured horrific suffering from melanoma. As stated earlier, I cannot go back in time to change the past, but I also know I cannot sit idly by and not take action to try to prevent this from happening to any other family or any other child. And the only way I know how to do this is through education. And that starts with the help from my senators, delegates, my governor in Annapolis, and the educators across the state of Maryland. Please help me save lives. Thank you.
Thank you, Ms. Flowers, for sharing your painful story. It does help us as we consider legislation. Are there questions for either Senator Klausmeier or Ms. Flowers? I see none, so I thank you both for coming to the committee, and that completes the hearing on Senate Bill 654. Thank you.
Thank you. Thank you
Okay.
very much.
Thank you. Senate Bill 664, Senator Ellis. Education, high school graduation requirements, applications for student financial aid. After Senator Ellis kicks us off, we will hear from Maureen Murphy, the College of Southern Maryland, followed by Denise Montagnac, a page for the Maryland General Assembly. Love that. And favorable with amendments, we will hear from John Willems from MABE, the Maryland Association of Boards of Education. So please welcome Senator Ellis.
Thank you, Vice Chair Kagan and members of my esteemed committee. Arthur Ellis here, Senator representing District 28, Charles County. And I'm presenting before you today, Senate Bill 664. And Lemuria, could you run the PowerPoint, please?
Will do. Give me 1 second.
Thank you. And while Lemuria does that, I want to say that Senate Bill 664 closely follows HB 0096. And they're doing the yeoman's work over there, yeoman's work over there in the House, a lot of amendments. And I know Senator Penske spoke about this bill, which will be going to the Education Subcommittee. So I'll be really quick and brief and hopefully very informative.
Senator Ellis, I'm still trying to find the PowerPoint. I have 663 here. I think it might have been an error.
Okay.
No, that's not it.
Okay. And while you try to bring that up, I'll just go ahead.
Okay. All right. I'll find it quick.
Okay. No problem. Thank you. Yeah, this bill, as written, as presented here today, has lots of amendments which were developed in the House. And with these amendments that came over from the House, we now have the support of the following organizations for this bill: the Maryland Association of Boards of Education, Maryland MSCA, Maryland
State Education Association.
Yeah. Thank you. Thank you.
That one I can help.
Maryland and the National Association for Advancement of Color, and AACP, CASA, Educational Trust, University of Maryland System, UMBC, University of Baltimore, College Tracks, Montgomery County, among other groups. So we're working with these groups and to really have a fine bill to help our students. So the purpose of this bill, Senate Bill 664, is to require high school students to meet with a counselor to discuss financial aid applications as a requirement for graduation. Additionally, the student, parent, or legal guardian must submit a form regarding the financial aid options to the County Board of Education. And a lot of the amendments, well, one of the amendments has an opt-out in case the student and or parent decide not to do this. Next slide, please. Okay, why is this bill important? Many low-income students do not apply for financial aid, but would qualify for it. Just 2 years ago, there was a young man going through the Charles County public schools. He was homeless and unaccompanied. That means no home to go to and no guardians or parents to look out for him. Very smart young man. He somehow applied to one of our colleges, was accepted, and he showed up with no money to pay. And several of our delegates in the region reached out to each other, and through our senatorial and delegate scholarship, we found the money to get him going and then helped him to fill out the proper paperwork. Now in his junior year, he's fully funded, doing really well. And this bill is meant to avoid a situation like that, where we have a college-bound student not having any support system fall through the cracks. So basically, I would kind of end up with that, ask for your support on Senate Bill 664 and for a favorable committee report. Now also, I don't know if Dr. Murphy is here. I know it was a long day. I'm sure she jumped off.
She was here earlier. Let's see if she's still around. Lemuria, do you know if she's still here?
I'm sorry, say that again, Senator Kagan.
Dr. Murphy, Maureen Murphy, I saw her earlier, but she might have left. If we're able to get her back, that'd be great.
Yeah, I did see her earlier. I'm not sure if she's still on. I can't see by the screens.
So
okay, let's hear from. Sorry.
I'm sorry. Community college two-year schools around the state have support this, including my home College of Southern Maryland and Dr. Murphy. And so we have letters in the file for them. And I just wanted to introduce you to this extraordinary young lady that's coming up next. And she has a story to tell. So I turn it back over to you, Madam Vice Chair.
Thank you, Senator Ellis, and props to Autumn, your new Chief of Staff. That was a really impressive PowerPoint too. So let's hear from one of our wonderful pages, Denise Montagnac, if I pronounced that right. If you want to unmute, we'd love to hear your testimony. Welcome to Education, Health, and Environmental Affairs.
Thank you, Vice Chair and the committee. It's DeMontagnac, but you were close. My name is Denise DeMontagnac. I am a senior at Thomas Dale High School in Charles County. I'm in support of Senate Bill 664. As Senator Ellis said, I do have an interesting story. As a senior, we never were really taught about financial aid. We got an email the day before and the day of October 1st telling us to apply for FAFSA. We were not given any instructions. We were not given anything else, just told us to apply for FAFSA. My mother is in the military. She's a single mom in the military, and she's also stationed somewhere else in Rhode Island. So she's not here with us right now. So it was very difficult trying to navigate and figure out how to apply for FAFSA together on FaceTime. It was incredible. It was a really long process because we did not know like whose account we were supposed to be on. There was like a parent account, a student account. We had to switch back and forth. One of us had to log in so I could fill out my stuff, she fill out her stuff. It was just a very confusing process. And even after, it took us multiple days to actually turn it in because we didn't know that every time you open up your FAFSA, you had to resubmit it. So it was a very unnecessarily stressful process. I feel like these problems could have been avoided if we had just a little bit more guidance from a counselor or our college and career readiness advisors prior to October. I feel like this should have been something that maybe at the end of junior year is something that we learn. Because even though we do have these resources, they only help the ones who ask for help, and those might not be the people who actually need help. This bill would reach out to students who don't know who to ask for help or have parents who are uneducated themselves on the process. It would help students who are first year and students who are first year or students whose parents don't know what financial aid is. Beyond that, not all students go into college immediately after high school. And if they were taught how to apply for financial aid, if they do decide to go into college in the future, they would already have the resources to complete a financial aid application by themselves. I believe that everyone has a right to financial aid, but not everyone is able to take advantage of it because they don't know how to access these benefits. Supporting this bill would give future students the direction that they need to have a successful future. Thank you.
Thank you, Mr. Montagnac. We're delighted to have you here. Thank you for being a page. Thank you for supporting Senator Ellis's legislation, and real life stories help us do our jobs better. So thank you very much. You did a great job. John Willems is here with favorable with amendments. from the Maryland Association of Boards of Education, Mr. Willems. Senator Ellis referenced amendments. Maybe you can chat with us about those and tell us whether you like what we're looking at so far. Thank you.
Thank you, Madam Vice Chair, members of the committee, and thank you, Senator Ellis, for sponsoring this legislation. Right off the bat, Senator Ellis's bill, the Senate version of this bill, is substantially different and improved, in our view, from House Bill 96, which was legislation that we had worked on prior to session with Delegate Jared Solomon. And based on a number of concerns that we raised regarding that legislation, particularly with regard to the distinction between the requirement to complete and submit the FAFSA application, as opposed to the requirement to confer with a school counselor or other organization to help explain the benefits of filling out those financial aid forms.
Okay,
That's a significant difference that helps avoid, I think, some of the unintended consequences of negatively impacting students and families who may feel stigmatized or otherwise reluctant to engage in this process of filling out and submitting a FAFSA form. That's really the overarching concern that we feel amendments are needed to address. But again, this bill as introduced is significantly better in that manner than the House bill, which I think the House sponsor would acknowledge, because he's fully supportive of sponsor amendments on the House side, largely to address these issues as well. And so we are supportive. We do want to continue to raise the issue of the optimum or maximum really amount of flexibility so that students and families can opt out, so that administrators can identify situations where the students or family may not want to fill out this form. But I will say that there are a number of incidents, as Senator Ellis has shared and the student shared, where school systems have dropped the ball in terms of connecting students with financial aid. And we certainly don't want to allow the culture of low expectations, if you will, which I cringe to say out loud, but for this committee, if for anyone, I might as well. And we would work to avoid that from negatively impacting a student's future, and therefore really supportive of the bill and look forward to working toward its passage, again, to accommodate those equity and accessibility and other issues.
Thank you very much for your testimony, Mr. Willems. Are there any questions for any of those three witnesses? Seeing none, I thank Senator Ellis for the bill and the witnesses. Denise, best of luck to you in your future. And that completes the hearing on Senate Bill 664. Passing it back to the chairman.
Thank you, Madam Vice Chair. We're going to move to Senate Bill 886, Senator Elfreth, Transfer with Success Act. Following the sponsor, we will hear from Mary Bolt, then Ashley Brown, then Bree Barone. After that, it is written testimony, and I do not see anyone signed up in opposition, although there is information from University System of Maryland. With that, Senator Elfreth, welcome back to EHE. You're an honorary member, it seems.
Thank you, Mr. Chair. My second favorite committee. I can say that without hesitation. It's good to see everybody. For the record, Senator Sarah.
You say that to all the committees.
I promise you, now that we're on Zoom and on the record, I do not, but I appreciate that. Thank you, for the record, Senator Sarah Elfreth, representing Maryland's District 30, here to present Senate Bill 886, the Transfer with Success Act. This, I think, is a very common sense approach to a problem that we experience on my subcommittee on budget and tax when we're thinking about how to encourage and get our numbers of students who at our 2 years and 4 years to make sure that we are retaining and graduating students in a timely and efficient manner so that their investments in time and certainly treasure and the state's investments of time and treasure are both well spent. I know this committee is very familiar with some of the challenges that community college students face as they move on to transfer to four-year institutions, particularly in the state. Obviously, the data is and research is clear. When students complete their associate's degree and move on to 2 to 4 years, they have a higher rate of success in graduation. But we still have kind of a left-hand, right-hand issue when it comes to our 2 years and our 4 years, and ensuring that the credits can transfer in a reasonable way. It's not going to be universal. We might always have disagreements between 2 years and 4 years, but at the end of the day, we need a more transparent and accountable process so that all students are using their time and treasure efficiently. So the bill's going to do 3 critical things. And let me just say, it's not a silver bullet. It's a start. We have a lot more deep dive to do. And I've already spoken with some folks on my committee to see what we can do over the interim to kind of get to this issue and dig a little deeper. But this bill is going to do 3 things. It's going to require students and transfer coordinators to be notified only if not only of denied credits, but also the reasoning behind when there are denials of credits of transfer. It ensures transfer coordinators conduct internal reviews into the denials within 15 days of receiving the denial, and requires that all schools include a report of all denials and reasoning behind those denials in their annual reports to the Maryland Higher Education Commission. Once a community college and once at a community college and once at the significantly more expensive 4-year institution, we need to make sure that students are using their time efficiently. At worst, a credit denial can stop a promising community student in their pursuit of higher education, and we don't want that to happen. Obviously, we're not always going to align, but we can be doing this better and more thoughtfully. This is a bill that passed the House unanimously last year, and it just passed this year in appropriations 23-0 and is currently on the floor. We obviously, a huge part of our work here in the General Assembly is ensuring the next generation of Marylanders have every opportunity we can possibly create for them. We currently have a system that's not serving everyone when we're not clear, we're not transparent or accountable in our transfer system between our incredible community colleges and our equally incredible 4-year institutions. And Mr. Chair, this is, as I said, one step in clarifying that process for the students and making sure that they can succeed. We're going to hear from some students who've experienced this hardship before, firsthand, about being denied credits and denied being able to transfer all the credits they've worked hard to accumulate. Mr. Chair, I also literally just got off the phone when you called me with the USM about their testimony. I think they had an older version of the bill from last year. The bill, as it's in front of you, addresses most of their issues. I think we have a 1-word issue between earliest and latest that we will work out. But for the most part, we are almost there with the USM to make this easy for everybody involved, but most importantly, in the best interest of our hardworking students. So I urge a favorable report. Thank you.
Thank you, Senator. Let's start with Mary Bolt, Cecil College, followed by Ashley Brown, followed by Bree Barone.
Thank you, and good afternoon, Mr. Chair, Vice Chair, committee members, and thank you, Senator Elfreth. The following information is taken directly from the Maryland Higher Education website from a page titled "The Student Guide to Transfer Among Maryland Colleges and Universities." And it says, students who enter higher education institutions in Maryland should have every opportunity to continue their learning throughout their lives. And some students begin their college careers at community colleges and transfer to a 4-year college and university. Others will transfer between 4- and 2-year institutions. And it goes on to say that a student may be able to progress from one segment of the public education system to another without a loss of time or duplication of courses. And to help with that, there are 5 specific processes or policies or guidelines. The guidelines and extensive processes listed do not guarantee transfer of credit between Maryland institutions of higher education. Each receiving institution must be held accountable when transfer credits are denied. This process will require additional work at each institution, but our students and sending institutions need to know why credits do not transfer. Without transparency concerning credits and course transfer decisions, transferring students lack the information to determine which courses and which credits will be accepted by the 4-year institution in which they decide to transfer. Students are required to retake a course, are then delayed in the completion of their degree requirements, and have an increase to the cost of their degree. Time and cost are the 2 main reasons why students do not complete their degree requirements. I urge your favorable support of this bill. It will benefit all students transferring credit among Maryland higher education institutions. This will also help post-secondary institutions reduce credit and course transfer denials and better serve all of Maryland students by expediting the time to degree and decreasing student debt. And I apologize, I did not introduce myself in the beginning. I am Mary Bolt, president of Cecil College. My apologies to the esteemed committee. Thank you.
Thank you, Madam President. Let's go to Ms. Brown, Ashley Brown, followed by Ms. Barone if she is here.
Thank you, Mr. Chairman. I would also like to thank the EHE Committee for hearing us out today. My name is Ashley Brown, and I am from the University of Maryland Student Government Association on the behalf of Senate Bill 886. Okay. I urge everyone to vote in favor of this bill as it is vital for the support of transfer students. Every semester, transfer students go through the transition of leaving their home institution to go to four-year institution. Among this population, there are non-traditional students who may be continuing education, taking evening classes, who may have children. We also have international students who don't have the easiest access to aid and first-generation college students. These students may be new to the higher education system itself and who are maybe new to the country. That includes me. I've been in the United States for less than 4 years. I've also underwent this process, and it is extremely stressful and time consuming, and it is extremely frustrating, okay? When transfer course credits are denied without explanation, this leads to financial and academic frustration because you'll have to dedicate time and you have to repay out of pocket to do courses without an explanation as to why those credits were denied. For international students who may have to change their degree timeline, they also have student visa timelines to consider, which makes this especially stressful for them to focus on their other coursework. With this bill, students will know why their courses didn't transfer, and this will aid and pave the way for other students at the community college level who wish to transfer to four-year institution. This promotes retention at all levels, and this is why I stand in favor of the bill. Thank you.
Thank you, Ms. Brown. Is Ms. Barone here from Anne Arundel Community College? Yes,
I am, Mr. Pinsky. Hello. Hello, everyone. My name is Bree Barone. I literally just patched into the call, so it's nice to meet all of you. I am the student member of the Board of Trustees. Sorry.
Your timing is impeccable.
Thank you so much. I wasn't sure if I could make it today, but I appreciate your time and flexibility. And thank you to Senator Elfreth for getting me on board with this. I am here in a favorable position for the Senate Education, Health, and Environmental Affairs Committee in regards to Senate Bill 886. Maryland's community college students face a multitude of trials and tribulations as they progress through their academic programs. For many, like myself, these challenges are presented through financial hardships, job loss, chronic illness, and more. These students endure these challenges to get them to their end goal, receiving a degree in the program of their choice. One challenge that has consistently presented itself as a hindrance to student success is the credit and transfer articulations between community colleges and the four-year institutions here in the state of Maryland. Students work tirelessly in their degree programs to make sure that they can get to the credits that they've earned and make sure that they receive all of them when they get to their transfer institution. However, this isn't the case for many students like myself. I've been at Anne Arundel Community College for 4 years, and I have accumulated over 110 credits off of as of this spring, 3 associate's degrees. And while I recognize that it is completely unreasonable to give me 110 credits because that's pretty unreasonable, but some colleges in the state barely offer 50 to 60. In fact, I have one outlier from the colleges in which I'm interested in transferring to that's offering 70, as well as one in New Jersey that is offering the same. Students lose credits when they transfer, and bringing forth multiple implications that may not be realized at surface level. First and foremost, students lose the credits that they worked tirelessly to complete, in addition to the funds that they put forth to obtain those credits, whether out of their own pockets or through generous financial aid. Loss of those credits means a financial loss for scholarship foundations, their constituents, as well as state and federal financial aid programs. And while we may have the opportunity to retake some of these courses at our four-year institution, that lessens the academic rigor of the programs that we're pursuing and therefore uses up vital financial aid that's already been expended to us. What can a student do if they're in a position where they have to retake their courses and they can't afford to continue? Furthermore, having students retake lost credits wastes time. The seat in a class needed for a student already at the 4-year could potentially be filled by someone who needs to retake these courses. Senate Bill 886, the Transfer with Success Act, gives students information and closure. No longer will we have to wonder why our credits weren't accepted. We'll know. And this legislation will encourage institutions to analyze the way in which they evaluate and grant transfer credit to students like myself and the millions of other students across Maryland's community colleges, for which I would love to be a firm advocate for. In passing this bill, we would be saving our students and their families money and time, as well as preserving vital state and federal financial aid for courses actually needed to be taken rather than those that need to be retaken, therefore promoting academic growth, challenge, and a learning environment for rigor for all of our students. I strongly support the legislation on behalf of my fellow transfer students, and I thank you all so much for your time and listening to myself and everybody today.
Thank you, Ms. Barone. Let me ask the sponsor, let me make a comment first. About 7 years ago in Senate Bill 740, in an overhaul of K-12 in coordination with community colleges, we attempted to move towards a common numbering, but not surprising, it met with a fair amount of opposition. People were not quite ready to make that jump. I read the testimony of Dr. Bauman at Maryland, and said the problem was not denial of credit, but in not using the credit towards someone's major in their graduation. So my first question is, do we need an amendment to address that if in fact that is a problem? Now it says denial of credit, I believe, in the bill. Now, I don't know quantitatively if the full flat out denial of credit is 10, 20, 50, or 80% of the problems, and how many are actually saying, you took a geology course and it will not count for X or Y. So that's one question I had. Let me stop there.
Okay. So I think part of the problem is just this denial without explanation, which is adding kind of insult to injury of a situation. So I'll leave it to the committee, and Mr. Chair, you've been working on this probably since before I was in college. And I know you're the expert on this.
Don't go there, please.
So if you think that amendment's needed, I read it as, if that's the reason for the denial, as long as that's being explained in a timely and efficient manner to the student. This is very much a chicken or the egg situation. And I asked this very question of the Secretary of Higher Education a couple of weeks back when he was in front of my committee of how are we better aligning and who's going to make this first jump. I think this is getting us there. It's grasping a better understanding of why those credits are being denied in the first place. And then from that, and hopefully these reports we'll be getting from MHEC, we can start to build a more thorough bridge between the two.
Yeah, no, I agree. We need the data. So we can inform policy, and we have to have a policy where students don't lose credit. And if a 4-year college believes a 2-year college provides a course that isn't up to snuff, they need to say that, and we need to address it. So
exactly.
Look, I think ultimately we need a common numbering, and we should have trust and confidence in all of our courses.
Right.
Okay, that being said, let's go. I'm going to go right down the list. Vice Chair Kagan, followed by Senator Carozza, followed by Senator Washington.
Thank you, Mr. Chair. Senator Elfreth, I always knew that you were an effective and adroit political person, but before I was in college was about the kindest thing. I know you were going to say before I was born, so that was nicely done. I have 2 questions. First, have you had an opportunity to talk to anyone at the universities at Shady Grove? USG really works on the transition from Montgomery College with an AA degree to transfer to a 4-year institution. So that's one question. And for those of you who don't know, or those who may not know who are watching, it kind of pulls the best programs from all USM campuses around the state. And so UMBC and UMES and College Park and everyone has sort of their best programs at USG, and the students really benefit. My second question is really about, I don't want to say this and sound snotty, but the credibility and the reputation of the 4-year institution. We're Johns Hopkins. And so if someone comes in with 80% of a degree, and then they come around and they tell the whole world that they have a Johns Hopkins degree, where most of it might have come from an institution whose coursework might have been less rigorous. So if you could speak to those two questions, please.
Okay, let me take the first one. I too am a big fan of the University of Shady Grove. I previously served on the Board of Regents in a prior life, and I absolutely love our regionals. I think they do an incredible job. I have not spoken with them. I see Senator King is in the room, and I will work with her. Delegate Solomon is the cross on this, who also I know has a great relationship with USG. So I will check with him, but I agree there's a lot of best practices to be learned. And as I said, I really want to be able to dig deeper into this over the interim. This is one piece of the puzzle, clearly, and we need to study this more as a body to get to the bottom of it. So that's your first question. Your second question, I can't disagree with that. I think that's a problem, not a problem, that's a challenge with all transfers. But I don't know how to answer that. It's I have friends that spent 1 year at one law school and 2 years another and have the degree from the second. I think that speaks to the university itself. If they're going to accept that student, obviously that student and their study and their work has to be on par with the university they're transferring to. And this is not to say that a 4-year has to automatically accept the 2 years. It's saying that we just need to be more upfront and accountable and transparent to those students, and frankly to this body, so we can fix the gaps in the bridge that exist right now.
Thank you, Senator Elfreth. Really important legislation for young people or not so young people getting educations. I also served on the Chancellor's Board of Advisors for the universities at Shady Grove, so I'd love to talk to you about any of that. Thank you, Chairman.
Thank you, Senator Carozza.
Thank you, Mr. Chair, and Senator Elfreth, thank you for the focus on the challenges with transfers. Not only did you have a good panel, but I actually have talked to some of my students that have had some challenges and have talked directly to Dr. Hoy, the president of Warwick Community College. And I just wanted to ask you, I know in some cases, like we have a pretty seamless transfer with Warwick going to Salisbury University, and those, they make it easy for the students, they fast track them, a lot of them already have jobs lined up. So when it works well, it works. I wanted to ask you though, because we talked about, Dr. Hoy's already mentioned to me, working with me on the data after we have that information. I wanted to ask you in the development of this bill, you know, how, you know, and I know that the Maryland Association of Community Colleges is supporting it, but did you talk to a lot of the individual community colleges to develop the legislation, and if so, who?
Thank you, Senator Carozza. I've spoken with my community college, who's the most important community college to me, about this bill. And I think you're right on. Warwick has a great relationship with Salisbury. Hartford Community College has a great relationship with Towson. USG with Montgomery College. There are best practices, but I think this is the reason we have a university system, and this is the reason we have an association of community colleges, so that we can take those best practices and elevate them to a system level. So I personally have not. I know the House sponsored the bill. This is the second year working on this, and I know he's spoken with Montgomery and a number of others. But I would love to work with you on this. And Mr. Chair, as I said, this is a project that's going to take a couple of years for us to get to the heart of, and bringing together the EHE and B and T to put our heads together on this is something I look forward to do. So, Senator, I would love to work with you once we get this data and figure this out.
I think my local community college would expect that. Thank you.
Thank you, Senator Washington.
Yes, thank you. Thank you, Chairman. And thank you, Senator Elfreth, for bringing this bill. When I'm looking at the language preceding your change and what you're asking for, and this must be what you're referring to, Chair, it looks like in 2016, we made all these plans about collaborating with public institutions of higher education to develop and implement a statewide transfer agreement, and that we're going to develop and implement reverse transfer agreements and that we were going to develop and implement incentives to obtain associate's degrees. Has any of that been done? And I don't know if anyone here on this meeting and this hearing could answer that. Maybe the chairman. I'm just curious just about that, and then I have a follow-up.
I can defer to the chairman. I can say, Senator, I ask this question of every 4 year that comes before my subcommittee on their arrangements and agreements with community colleges, because I think this is part of us getting to that higher attainment level. So I ask it of the 4 years, but I've not asked it of MHEC per se, but the chair might know more.
Yeah, some progress was made on the reverse transfers. Mm-hmm. But I can't tell you for sure that all of these aspects on line 19 through 35 have been accomplished. So some of these charges have been pursued.
So you know, to the sponsor, and then also to our committee, and I have an interest, as you know, I teach at a 4 year. And recently, as a student was interested in transferring from the 4 year I go to and wanted to take my math class. But the receiving university wanted a copy of the syllabus. So there's like ways to do it. But it just seems like there has to be procedures. Common numbering might not necessarily get us there, because there's different interpretations of what a 200 level is and a 300 level. But it just seems like we want to get this data, but then I don't know what we get to do with it from a policy other than like giving the student, as you say, feedback. So I would like to talk with you, and maybe what we're looking at is something during the interim, or, you know, a summer study or something to really get at, you know, the real issue. So it's like what these course, you know, increasingly students are going to community colleges because the price of the 4 years, you know, there's just more around that 2 years, an associate's degree, and then go to a 4 year. But there is the reality, I would say, that kind of to Senator Kagan's statements around, not like, it's just that so there's some differences in course content, and that can't be ignored. You know, I would say there could be, you know, the courses in some of the community colleges could be more rigorous than some of the 4 years, depending on what 4 year you're talking about. So I think it's a two-way street there.
Absolutely. And your instinct was mine when I read the bill as well, that this is a great first step, but we have a lot more work ahead of us to solve this problem. So I look forward to working with you on that.
Thank you, Chair.
Yeah, and Senator Washington, it could be a three-way street. It could be the integration and the logistics. It could be that the content is different, or it could be some don't feel it's rigorous enough. I mean, there are really only 3 or 4 that I've heard over the years, sometimes publicly made, sometimes privately made complaints. And I think the idea here is the collection of this data will help better inform us to what the problem really is.
Mm-hmm. Got it.
Okay. There's no opposition. We've heard from the panel. That concludes the hearing on Senator Elfreth's bill. Thank you for joining us, Senator.
Good to see everyone again. Thank you.
The final bill of the day, we're going to Senate Bill 890, Senator King, Early Childhood Education Child Care Provider Support Grant Program. We'll start with the sponsor, Senator King from Montgomery County. She'll be followed by Laura Wildryer, Ruby Daniels, Christina Pooch, and then Sarah Mikey. And while I look at the sign-up sheet, while there are a couple of favorable with amendments, I do not see any opposition, written or oral. Senator King, welcome back to the committee.
Thank you, Mr. Chairman. I think you just saved the best bill for the last today, right? I'm going to be brief because the members of my panel can give you much more personal examples of the devastating toll that this pandemic has had on our state's child care providers. Both EHE and B&T members are very familiar with the importance of quality care for our state's children and the importance of quality care for our state's economy. The childcare industry is critical to our state's recovery, and yet many of these programs are not going to survive without some substantial assistance. I was pleased to hear just recently that the governor has established a grant program to support eligible childcare programs throughout the state to help meet operating costs and address lost revenue. That's great news, but this will not be enough to get all of the 8,000 plus childcare providers back on their feet and ready to serve our state's children as we pull out of this pandemic. Senate Bill 890 will establish a grant program in the Department of Commerce in consultation with the State Department of Education to provide funds to support the development and the expansion of childcare programs. The grant program won't take effect until fiscal year 2023 and will be a great complement to the governor's grant program. I'm also offering amendments to clarify that the child care provider support grant is available to all child care providers, including center-based and family child care programs, and to programs who have closed or struggle to remain open due to the pandemic. Child care industry needs our support to survive this economic crisis and to ensure working parents can continue to have quality care for their children. So I ask for your favorable report on Senate Bill 890.
Thank you, Senator King. Let's go to Ms. Wheeldryer.
Good afternoon. Hi, it's been a long day, but we're ending on a high note. So thanks for your time and attention and your support of the Child Care Provider Act. I'm Laura Wheeldryer, Executive Director from Maryland Family Network. We're a statewide nonprofit and leading voice in early childhood. And today I'm here to speak on behalf of babies and their parents who need childcare and on behalf of childcare providers who need your support. MFN has long been a voice on the critical nature of childcare. It is an unfunded public good that produces two-generation positive outcomes. Childcare allows parents to enter the workforce and is, in effect, the workforce behind the workforce. I could sit here and use up all my time summarizing the benefits of high-quality early care and learning, especially for our most vulnerable children, but I'm going to leave you with this. James Heckman, Nobel Award-winning economist, has found that interventions in the earliest years of a child's life provide an up to 13% return on investment for society at large. The last 11 months have been catastrophic for childcare, which operates on a razor-thin margin in the best of times. We at MFN conducted a statewide survey last May, and we've just completed a second round of that survey and found, perhaps not surprisingly, that things have only gotten worse 11 months into this pandemic. Providers are facing the dual challenge of dramatically lower enrollment and significantly higher expenses. So let me just put some numbers on that for you. Our survey found that providers are reporting their monthly expenses have increased on average $5,339 per location. And at the same time, 79% of providers are reporting they've experienced a financial loss. And the 2,000 plus providers who responded to this statewide survey report that they are on average at 59% of their licensed enrollment capacity, which is totally unsustainable. A whopping 49% of childcare providers say they may close for good if help doesn't arrive soon. And help is indeed what we are talking about today. So let me just close by saying, please, on behalf of working parents, childcare providers who have been absolute heroes over the last 11 months, and on behalf of babies and young children who are the future of this state, we urge a favorable report, and thank you so much.
Thank you, Ms. Wheeldryer. Let's go to Ms. Daniels, Ruby Daniels. Are you with us?
Yes, hi. Good afternoon. I'm going to be brief. I know it's been a long day for everyone. My name's Ruby Daniels. I'm a family childcare provider in Howard County, and I'm also the president of Maryland State Family Childcare Association, also known as MSFCCA. First, I'd like to thank everyone for listening to this bill. MSFCCA represents over 4,000 registered family childcare programs that are an important part of the childcare delivery system and early childhood education system. I'm listening to a lot of the school and colleges and stuff, and we educate the youngest learners. COVID-19 has impacted many lives and businesses. Family childcare programs, also small businesses that are women-owned and mostly run by minority providers, have been greatly impacted by the pandemic. Most are unable to avail of any financial relief. Some have been forced to close or are struggling to remain open due to the financial impact of the pandemic. The repercussion of COVID-19 on family childcare and childcare centers will no doubt have far-reaching effects into the future. The programs that have remained open during the pandemic and have continued to suffer financial loss due to low enrollment or loss of enrollment. Our income is low, but our expenses continue to rise. During the COVID-19 pandemic, family childcare providers was vital in keeping essential personnel working. In fact, family childcare providers and childcare centers have continuously cared for children, including school-age children. While schools are finding ways to safely reopen, childcare never closed. We served all the children, including the school-age children, all these months during the pandemic and now. We will continue to support the children and the families of Maryland. It is important that we support the childcare community so there will be a safe learning environment for our children. MSFCCA would like this committee to give Senate Bill 890 a favorable vote. This bill is an investment into our children and our future. Thank you so much for having me.
Thank you, Ms. Daniels. Let's go to Christina Pusch.
Great, thank you. Good afternoon, esteemed EHE committee members. I'm Christina Pusch, Executive Director of the Maryland State Child Care Association, representing more than 4,500 child care early childhood professionals working in Maryland. And thank you for passing SB 436 last night as well, this committee. The pandemic has devastated many small businesses, including Maryland's child care sector, which is the backbone of our economy. Childcare is an essential key to economic progress, allowing working families to resume their jobs and stimulate the economy. Childcare and early childhood programs continue to strive to effectively and safely care for and educate children, meet the needs of families, protect staff, and cover all the expenses required to keep their doors open. Childcare programs in every state already operate on razor-thin margins, as Laura said, and teeter on the edge of financial health. Enrollment costs and important teacher-child ratios that cap revenue capacity have, since March, we have not recovered and it has impacted us to the highest degree. Due to the COVID-19 pandemic, our providers have faced drastic reductions in children served while fixed costs were unchanged and additional expenses incurred due to CDC guidelines for childcare. Additionally, PPE and cleaning supplies have skyrocketed in price. Temporary issues such as trying to find substitutes when staff are sick or when childcare is shut down for suspected or confirmed cases of COVID-19 and parents have to find alternatives has caused fear, frustrations, permanent closures, classroom closures, and the result is negative impacts on children, families, women especially, and our economy in short and long term. MSD data reports there were 7,858 licensed providers pre-pandemic in March 2020. As of December 2020, data shows there are currently 6,577 licensed providers that have completed the form and have been approved to reopen to serve children and families. There were 977 that have not submitted a form to reopen and 279 have permanently closed in December. As of this month, February, 500 programs have permanently closed and hundreds have still not asked to reopen. The loss of childcare businesses equates to the loss of thousands of slots, and it's deeply concerning. Significant closures means less choices for families in the future, therefore continuing the inequitable access for communities of color and unaffordable care for far too many families. Without this additional support like SB 890, we run the risk of exacerbating childcare crisis that existed long before the pandemic, making it harder for parents to work, especially women, leaving children without the critical supports for their health, development, and well-being, and jeopardizing the livelihoods of childcare professionals, early childhood educators, disproportionately women of color and immigrant women. Many childcare programs are losing thousands of dollars monthly, as we heard from
Ms.
Laura.
Bush, you're
Yep.
going to have to wrap up. It has been a long day and we have another
Pandemic
meeting.
relief to cover and rebuild our childcare businesses, families will suffer a shortage. This lack of support and investment will slow the recovery process. We support this bill and thank Senator King for sponsoring it
Thank
and
you.
have a favorable report.
Thank you. And finally, let's go to Miss either Mikey or Mickey. I'm sure I butchered it.
Mickey, yes. Good afternoon, Chair Pinsky, Vice Chair Kagan, and members of the committee. I'm Sarah Mirsky-Mickey, Deputy Director of the Baltimore Jewish Council, which represents the Associated Jewish Community Federation of Baltimore, all of its agencies, as well as the Organized Jewish Community of Baltimore. I'm here today in support of SB 890, which has been explained by the sponsor and previous speakers. In Greater Baltimore, we have almost two dozen Jewish early childhood centers, and they are suffering. Some, like 16% of all early childhood centers in Maryland, have closed due to COVID-19, hopefully only temporarily. To give a very quick snapshot, we have two JCC early childhood centers. One has actually been closed since the starting of the pandemic, and the other was closed for several months in the beginning and is now only operating at a 60% capacity. For FY21, the center is projected to have a revenue, not a profit, of $500,000 less than the previous year. And this includes the help of the PPP loan. Additionally, costs have gone up significantly, including the cost of PPE, which just for this one center has cost over $25,000. And think about this, whenever a teacher has a contact, we pay that teacher until their COVID test comes back, as well as paying for a substitute. In the summer and early fall, this could take a week and sometimes 2 weeks to get results back, while the JCC was paying for the salaries of 2 teachers. If we do not do something to help childcare providers who've all suffered financial hardships during the pandemic, we will have another crisis on our hands when things eventually do go back to normal and parents and guardians are required to physically go back to their office. If there are no or a scarcity of childcare providers, parents and guardians who are required to go back to their office will have to make a very hard choice between going to their office or taking care of their young child. This will undoubtedly disproportionately affect single parents, women, and low-income individuals. SB 890, which will provide funding to help these childcare centers stay open, needs to be an integral part of our state's COVID-19 relief. For these reasons, we ask for a favorable report on SB 890. Thank you.
And thank you. Questions? There are no opponents signed up. Questions for any of the proponents' advocates, including the sponsor? Seeing none, I don't know if it's tiredness or what, or the just impressive testimony from the sponsor and the witnesses. That concludes the hearing on the final bill of the day. Committee, thank you. You all may leave. Senator Lamb, 15 minutes, 5 o'clock.
Sounds good.
The environmental subcommittee has a meeting. It is a virtual meeting. A new link has been sent out. Is that correct, Senator Lamb?
Yeah, I believe there's a new link.
You have a new link.
Yep.
The the environment subcommittee will meet in about 12 or 14 minutes to do work, I think, just on one bill today.